This is the time now, Adarsh. You go ahead and start and introduce me. And Ravi is
First,
watching.
yeah. First, I'd like to welcome all of you, both the staff who's teaching as well as the participants. We are very fortunate to have this occasion of the what's called the online yoga therapy retreat number 10. And it is being sponsored by Taksha Institute. And I will give you a little breakdown of how we started. We were very fortunate to have Dr. Dilip Sarkar, who's MD, and after his little episode of his health at a young age, when he got a quadruple bypass, I was fortunate to invite him, and he totally changed from teaching, became an Ayurvedic doctor as well as yoga therapist. And so I was very fortunate that way. I said, well, he must join Taksha Institute. And we call it for short Taksha, but it's Taksha Shila. And the words, they are Sanskrit words. Taksha was a very famous town in the northwest of India. And that's where all the goods from east and the south of India used to come and get stored before they went through the Khyber Pass on to join the, we are talking about few thousand years ago. So I'm giving a history, a little bit history for those. So yoga goes back to 5,000 at least recorded history, and even earlier, maybe 10,000 years ago. So we are using the word therapy, and Dr. Sarkar will explain the difference, yoga therapy, what he means by that. But the title of the today's is the theme is role of yoga therapy for COVID-19 and immunogenesis. And so that will teach you about the immunity aspect of how yoga therapy can help you. That is one of the reasons. Also, I want to tell you that one little episode, since I used to teach history and philosophy of science, that Alexander, who's known as Alexander the Great, he was told by Aristotle to go to Taksha Institute, University, and bring me the finest yogi from there, teacher. And he came. He made friends with the king over there. He said, I'm not here to fight with you. I just want to bring one person. He said, you only want one? We have 2,000 faculty here. And the university was there. And so he said, take 100 if you like. So he took, okay, I'll take 100. And guess where he sent the rest of them? He sent it to Alexandria, his newly formed city in where he came from. And that's where the start of the Alexandria Library starts. The person he took name was Kalyan, and he changed the Greek, always used to change, they call it Kalanos. And that's another episode of his, and it's written in his autobiography, the name Kalanos, but the name was Kalyan. And Kalyan means compassion. And anyway, he was the finest yogi. I don't want to go into that, but what I want to tell you is the very old recorded history of yoga as part of that. And with that, I would like to let Dr. Dilip Sarkar take over, because he is going to bring us to the modern world and the pandemic situation that we are going through. And so, Dilip, you are on.
Thank you. Thank you, Adarsh. Good morning. Welcome to our yoga therapy retreat. We have been doing it since 2010. This year, unfortunately, the situation made us to be online. We are having little technical glitches, so we are a little bit few minutes behind time, but we're overcoming. So now what Dr. Deepak said, that you all know about yoga, but yoga is a therapy. Yoga as a therapy is it's a philosophy of yoga, which is called the Yoga Sutra of Patanjali. And we'll be presenting that. Another presenter, Abha Gupta, will do. It's a practice called Patanjali Ashtanga Yoga, 8 limbs of the yoga. It is a daily routine, dinacharya. It is also a lifestyle. So what we have been noticing today, and it is an ongoing study. There's a hospital in Harvard University, which is called the Beth Israel Deaconess Hospital. They are having a National Institute of Health funded study to see the incidence of COVID-19 on the people who are practicing a routine yoga and yogic lifestyle. Indian Yoga Association, the largest umbrella under which all the yoga masters and yoga studios are there, they are doing an ongoing study to see the incidence of COVID-19 on a regular yoga practitioner. And we find it out, the results are outstanding. People are practicing yoga, are preventing COVID-19, treating COVID-19, and treating what is the new phenomena. It's called the post-COVID-19 syndrome or long hauler syndrome. I will go ahead and present all these things slowly throughout the whole day. And I welcome all of you. 2 little housekeeping, that when we are presenting, all of you put it on a speaker view. And when we are practicing, our main practitioner will be on a speaker view, and all of you can be on a speaker view or a gallery view to see. After each presentation, we'll have a few minutes for question and answer. Please do it on the chat. Our teacher, Abha Gupta, will look at the chat and will answer all of your questions. At the end of the day, we will have ample time, lot of time for all of you to be in a gallery view, and you will be asking question to all of us. All the presenters will answer. So with this introduction, traditionally, we start any yoga session first with the blowing of the conch shell. Then we start with the invocation. Then we present the philosophy of yoga. For us today, we have a Shikha Sarkar here, Abha Gupta with the conch shell, and also we have a Mita Chakravarti. And any of you, any other person who has the conch shell, please blow the conch shell at the same time. We'll do 3 conch shell at the same time. Let's go ahead and start. Thank you. Thank you. This was our opening of our yoga session. Now, I will invite our presenter, our famous yoga teacher. She's a certified yoga therapist, and she has been teaching with us for last, should I say the years, Abha? I forgot, huh? Over almost 12 years. So she will start with the invocation, then will be followed by your presentation on the Yoga Sutra of Patanjali, for its health benefit. Abha is all yours.
योगेन चित्तस्य पदेन वाचाम् मलं शरीरस्य च वैद्यकेन योपाकरोत्तं प्रवरं मुनीना पाताञ्जलि प्राणाञ्जलिरानतोऽस्मि.
On the laptop.
Salutations
Into the screen.
to Sage Patanjali, who presented to the world yoga that helps the mind, grammar for speech, and Ayurveda for human body. Thank you, everyone. Good morning, everyone. And it's so good to see so many of the familiar faces and also welcome all the new faces. You can see the slide. Let me exit and share a different slide here. So I think you should all be able to see that. Let's see here. Okay.
Unshare. Now you open your slides on a desktop and share it. Here, got it. Okay.
Okay. Can you see it now?
Yes, we can see it. Perfect. Abha, go ahead.
Okay, great. Very good. All right, everyone. So welcome to the 10th yoga retreat. This is a very special retreat because this is the first time that we are doing this online and virtually. It is also very special because we are going through these very different times, the times of pandemic that has created a kind of turbulence not only outside around in the world, but also inside in our inner world, within our mind. So, that there is fear, there is anxiety, there is stress. And if you notice, all of these three emotions, fear, anxiety, and stress, these are all related to mind. And when we are stressed, what happens? Our immune system's ability to fight off antigens is reduced. And as a result, we become more susceptible to infections. And also, when there is stress, the stress hormone can suppress the effectiveness of the immune system. And nowadays, many of us have taken the vaccine, and I hope all of us have taken the vaccine. But what happens when there is chronic stress and anxiety, it can make the vaccines also less effective. So prolonged stress and tension, it weakens the immune system. In general, we can say that chronic stress wears the body down. So what is stress and what is anxiety? It is a thought pattern. It becomes mechanical. These are undesirable thoughts that keep coming. The sense of overwhelmed. You feel overwhelmed. There is feeling of frustration for not having any control. And it is a kind of narrative that our mind tells us and we believe it. So it is a mental activity. And these are mental formations. It's a state of our mind. And this directly pertains to Patanjali, Patanjali's Yoga Sutras. As majority of the sutras, they refer to mind. And he put this together in 2nd BC, that is before the beginning of Common Era. That is more than 2000 years ago. The beauty of it is that it is more relevant to our lives today. Today, on March 21st, 2021, here we are discussing his works, which is as relevant now as it was then. You know, this itself is the best tribute that can be paid to sage Patanjali. You know, that his work is alive, it's buzzing, it's thriving. Here we are talking about it. Let's go to the next slide here. So who is Patanjali? Patanjali is considered the father of modern yoga, who lived approximately more than 2000 years ago. Now, as we know, yoga has been around for over 5000 years ago. So that was way before Patanjali's time. However, the information about yoga was distributed. It was spread out into various scriptures. What Patanjali did was to compile the information, and he codified the information in a very organized manner in the form of one-liners, which are very concise, very succinct, brief, tight. And, he had to do that because remember, this is the time period before paper was invented. So the information and the knowledge has to be passed on orally, verbally from one generation to the next generation. And I think, Patanjali was the first tweeter, because these lines are like a tweet. Each of these line is no longer than 40 syllables. And this way it was easy to remember and of course, memorize, because that was the way that the information was transferred. So there are 196 sutras. Sutras are like aphorisms. Like I said earlier, these are one-liners, or you can call these tweets. So these are 196 tweets. And if you, just to give you a sense of how many sutras that is, if you take a regular sheet of paper, this contains 25 lines with double spacing and all the margins around. You can get 25 lines here. So we are talking about 4 pages, and that is it. We're talking about 200 lines, that's 4 pages. So it was easy to memorize and pass on. But of course, now, you can find books that have the meaning of the sutras, the interpretations of the sutras, and you can have a book for, like 500 pages or more. In fact, I have a book here and I use this a lot. I refer to this. This is one of the master books on Patanjali's Yoga Sutras. This is called Light on the Yoga Sutras of Patanjali by BKS Iyengar. And I also have included the reference in the handout that you have received. So, these 196 lines, they are divided into 4 sections. And each section has a focus. So this is really like a roadmap for a yoga practitioner, or you can call it GPS, because it's navigating the practitioner through the process of yoga. So the first section is Samadhi Pad. That has 51 sutras, and the focus is on purpose and goal. Patanjali doesn't beat about the bush. He gets straight to the point. What is the purpose of yoga? What is the goal of yoga? The second section is Sadhana Pad, which has 55 sutras, and the focus is on practice. The third sutra, in fact, yoga is all about practice. Actually, 95% it's all about practice. Only 5% is about talk and theory that we are doing right now. So we'll be spending a lot of time today practicing. Third section is Vibhuti Pad, which has 56 sutras, and the focus is on experiences. And finally, the fourth section is Kaivalya Pad, that has 34 sutras, and the focus is on freedom, the ultimate connection with the self, that is self-realization. So total there are 196 sutras. And this is really helpful because especially nowadays, there are hundreds of yoga forms out there and you can easily get lost. So this is like the GPS I said, it can navigate through the practice of yoga. Now, the title of the talk is, implications of Yoga Sutras for Patanjali, of Patanjali for health and wellness. So what is health and what is wellness? So health is dealing with our physical aspects of the body, also our mental aspects of the body, mental health. But when we talk about wellness, we are talking about more than that. We are talking about our environment, our fears, our interactions with the society, whether we are having good relationships with people, what, our interactions with others are pleasant or unpleasant. Do we feel safe? So it is a state of a mind, it is a way of existence. And so it is affecting the different dimensions, the emotional, psychological, social aspects of our being. And together, all of these dimensions together form what is the wellness that we are referring to. It also reminds me of, in education, we talk about Maslow's hierarchy of needs, which has those 5 layers in the form of a pyramid, the physiological that deals with food, then safety, belonging, self-esteem, respect, and finally self-actualization, which deals with, what is the purpose of life? What is the meaning of life and creativity? So all of these dimensions together form, the wellness aspect. Um, Now we think of health and wellness as going for a physical, getting a medical physical checkup done, and that's it. But yes, that is very important to get that done. But the numbers that we get at the end of a physical medical checkup, those numbers are not always sufficient. We all know of someone who can have the right numbers in their physical checkups, but still suddenly have a major health breakdown or some major episode. And you don't have to go very far. Actually, if you have read this book, let me show it to you. And I think Dr. Deepak also mentioned Dr. Sarkar's episode here. So yoga therapy, Ayurveda, and Western medicine, a healthy convergence, by Dr. Dilip Sarkar. And this itself, it talks about the incident, the episode that Dr. Deepak was mentioning earlier. So basically, it's like you can have a physical checkup, you can get a clean sheet, and you can find your blood pressure is normal, your cholesterol is normal, the blood sugar is normal, and yet have a breakdown in the system. Conventional medical tools such as blood tests and x-rays, these are highly valuable for diagnosing a disease at an early stage. However, they can detect a disease only after it has manifested itself, or it has there are some physical manifestation in the form of symptoms. For example, in the form of an elevated blood sugar, which is detectable. So in the Western medicine, the absence of a detectable problem implies you are healthy. Whereas in Ayurveda, the absence of vibrant health means there is illness. In other words, our natural state, our default state is healthy, vibrant, lively, energetic. We are robust, peppy people, and that's who we are naturally. So the World Health Organization, they define health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Now, Patanjali refers to these different domains as, the 7 layers of our being. Like the nesting dolls, or, the Russian nesting dolls, you have different layers. So you have the physical body, and then you open it, and then, there is the emotional, psychological, and so on. So Patanjali talks about these. He also includes a layer called receptive layer, which has to do with our senses. So let's look at the sutra. This is one of the Patanjali sutra that refers to the 7-fold aspects of our body. And this state is not something that is esoteric, or it is, hard to reach. So as you can see here, the Panchkoshas, and the outer layer refers to Annamaya Kosha, body, that's the physical body. And then you have the second layer here is Pranamaya Kosha. And like I said, Patanjali also talks about the layer, receptive layer of senses. Then there is the manomaya kosha, which is the mental aspects of our being, referring to mind. And then there is the Vigyanmaya kosha, which refers to discernment, our ability to discern and judge and evaluate. And then the blissful state, the Anandamaya kosha. And of course, all of these layers are in this field of pure consciousness. So the blissful state right here, Anandamaya kosha, it is not that it is a very esoteric state or that it is very deeply embedded and hidden. Actually, it is right here, right now. It is this joy that you feel emanating from every cell of your being. And it's like when you look at the sunset over the ocean, or you're looking at sunrise or reflection of moon, or nowadays the trees are pregnant with flowers and cherry blossoms are about to bloom. So the joy that you feel, that is the blissful state, the Anandamaya kosha. And this joy is pure, it is impeccable, it is wholesome. This is only a window to the joy that we actually are, the natural state, which is not dependent on an external object. So the question is then, why aren't we always joyful? Why aren't we always in this state of bliss? And that is because, we get so wrapped up in the clouds of our thinking, our thoughts, which are covered by the mental chatter that's constantly going on, and the labels that we carry. These labels have tremendous weight. The label of our name, our last name, the nationality, the ethnicity, the linguistic group we belong to, the health issues we define ourselves with, sometimes the health issues, the relationship status, the financial standing, work titles, and so on. So stripping off these labels, like peeling away the layers of onion, where is the onion after all the layers are gone? All that is left is space, stillness, presence. And so Patanjali doesn't beat about the bush. He gets straight to the point. In the very first 3 sutras, he talks about the purpose and goal of yoga. So here he says, Yoga Chitta Vritti Nirodha. Yoga is the cessation of movements in the consciousness. So yoga is talking about stilling, in this sutra, he's talking about stilling the movements in consciousness, the mental formations. These are gross as well as subtle thought patterns of the mind field. And what are these mental formations? These states of mind can be disturbed, restless, troubled, wandering mind, dull mind, heavy mind, or feeling, get depressed, forgetfulness, or just one-pointedness, focused mind. And then he talks about nirodha, which is, of course, highly mastered, controlled, regulated state of mind. And it is not suppression of thought or repression of thoughts or emotions, because that is not healthy. It is that the attention is now moving in the higher orbits, and it transcends the thought patterns of lower orbit like fear, anxiety, stress. So the false identities begin to drop off, and it is drawn to itself, the stillness, the presence. The mind naturally becomes one pointed and still, and the attention moves inward. So there is this deep stillness. It's like the mind of a monk who doesn't get very easily distracted. And this leads to the next sutra, which is Tada Drishta Swarupe Avasthanam. Then there is an abiding in the essential nature of who we are. So this is a result of being anchored in oneself. The true self shines forth because you have now realized who you are, your true nature. And it is not attaining something, it is not like realizing because it's like realizing what you have always been. This is our natural self, this is who we are. It is basically that the faulty concepts, the misperceptions, the delusion, and the clouds of misunderstandings, they all begin to fall off. And as they drop away, the natural self shines naturally. So the source from which everything is emanating, that source permeates all the layers that we talked about earlier. So Patanjali doesn't describe the source because the source is not an object. So it doesn't have attributes and it cannot be described. It has to be experienced by each one in our individual, in our own manner. So the second section, I have included one sutra. Obviously, in these 30 minutes, I cannot talk about all 196 sutras. But what I've done is taken selected sutras from each of the section to highlight on those sutras today. So in the second section, in the sutra, he talks about Ashtang Yoga. That is the 8 rungs, the 8 steps of the ladder. And these 8 limbs refer to, let me just show you what are the 8 limbs here. Yam, Niyam, Asan, Pranayam, Dharan, Pratyahara, Dharan, Dhyan, and Samadhi. So here, the first 2 limbs, Yam and Niyam, these are the foundations for any practitioner of yoga. So what is yum? And yum, not like yum, delicious food. This is the Sanskrit word yama. Yama refers to self-regulation in terms of how to interact with the world. So the 5 codes within yama are ahimsa, which refers to non-violence. Non-violence, not only physical non-violence, but also non-violent thoughts. The second one is satya, which is truthfulness, being honest. The third one is asteya, which refers to not stealing, not only objects, but ideas or concepts. The fourth one is called brahmacharya, which is dwelling in Brahma, the highest reality. You're anchored in this highest reality, like, anchored to the North Pole. The fifth one is called aparigraha, which is not hoarding, non-possessiveness, not acquiring, and non-indulgence, and not being greedy. So these are the yamas. Now the niyams, they refer to the observances or the practices dealing with the personal self. So it's more like self-training, dealing with the inner world. So what are those? So number 1 is cleanliness, shaucha, cleanliness of the body and cleanliness of the mind. Number 2 is santosh, which refers to contentment or acceptance of what is. Number 3 is tapa, which is training of the senses, practicing and working on it. Number 4 is swadhyay, which is not only studying the scriptures and reading, but also studying the self-study. So it is studying oneself, reflection, self-inquiry. And the final one is Ishwar Pranidhan, which is surrender. So surrender is trust. Sometimes people have issues with the word surrender and they think like surrendering means giving up. It is not giving up. Surrender is something that we do all the time. When you take a flight and, when you are in the flight, you surrender to the pilot. We don't constantly pull out our GPS and check if the pilot is going in the right direction. Is he making the right turn, left turn? Is he making a U-turn? Or is he going to get me to the direction, right? We just kick off our shoes, turn on the movie and watch and relax. We have surrendered. We trust the pilot. So the same way, when we are eating food, we eat food and then we surrender to our digestive system, which I call, the food processor of our body. We don't constantly worry about, whether my pancreas is producing enough enzymes or if my liver is producing the chemicals that it's supposed to do, for digestion. Basically, we eat, we relax, we sleep, and we know that the digestive process will take care. That is surrendering to the universe. In fact, Patanjali talks about it in his second section in Sutra number 21, where he says that, the universe is here to serve you. The nature is here to serve you. It has brought you here. It's taking care of you and it's here to serve you. So these are niyams. And the niyams are, about training the mind, like you saw here. So now let's move on to the next step, which is the asanas, the physical body, the postures. So we all know about it. We will be doing a lot of it. But this third rung, the third step, asanas, is what we tend to equate yoga with. Nowadays we think of yoga means asanas or postures. That is just one of the 8 limbs. Yoga is a lot more. It's way beyond just the postures or the asanas. So let me just show you with reference to yoga. Today, as you practice, be mindful of 2 things. And that is referred to in this sutra, Sthira Sukham Asanam, steadiness and ease in a posture. So what that is referring to is that there should be comfort in the posture and there should be effortless breathing. So how do we know that we are comfortable and we are not going beyond our individual threshold level? Based on our effortless breathing. And you have heard Dr. Sarkar say that a lot. He's always talking about this particular sutra. Now, when we talk about effortless breathing, it leads directly to the next sutra, which is pranayam. The next level, the next rung is pranayam. The only thing that stays with you from the moment you are born until the last moment on this planet is your breath. Friends, family, houses, places, neighbors, relatives, they change. Breath stays. When you get stressed, what changes? Breath. When you get angry, what changes? Breath. When you get scared, what changes? Breath. When you're excited and happy, what changes? Breath. So we experience every emotion with change of breath. And when you learn to navigate and manage your breath, you can navigate any situation in life, especially stressful, challenging, and difficult situations. And we'll be doing more of pranayama today. And pranayama is preparation for the next rung, which is called pratyahara. So from pranayama onwards, the rungs are mind oriented. It's about a journey within. So pratyahara refers to withdrawal of the senses. And today we will be doing Brahmari Pranayama, where we are closing the eyes, closing the ears. So you're shutting off the visual input and the sounds, and a very powerful, pranayama. So we will be talking more about it, and we'll be actually doing it more than talking. We'll be doing this. Pratyahara leads to the next rung of the 8 limbs, and that is dharana. Dharana is concentration, and dharan leads to the next step, because intensified dharan becomes meditation, dhyan, and intensified meditation becomes samadhi. And that is the feeling of, that is the liberation, the emancipation. So this is a journey inward, becoming in tune with oneself. Nowadays there is so much social media out there, and we know that, we know what my high school friend had for dinner last night, or which friend got her nails painted. But, our attention gets pulled outward constantly by the drama of the world. And it's always going to be there, this drama or this, the action. But as a result, we become, what is happening is we get disconnected and with ourselves. And there, as a result, there is anxiety, stress, fear, tension, mental health cases are on the rise. Suicide rates are amongst the youth are high, and there are mental and nervous breakdowns are on the rise. And internet has increased our connectivity with the world, but as a human race, our connectivity with ourselves has gone down. So yoga is a journey inward, and it is connecting with oneself, using, uniting with oneself. That is the union that we talk about. So I'm almost coming to the end of this session. In section 3, Patanjali refers to this sutra. And again, you have heard Dr. Sarkar use it a lot, that in stages, impossible becomes possible. So you do step-by-step practice from basic to advanced postures. And this is the last sutra that I'm sharing today, and this is very relevant today. This is about changing perceptions, and it sums up our experiences. So it says that each one of us has different mindset, different experiences that we have had, and these individual experiences color how we behave and interact and react and perceive the world. So in the image, you can see a duck or a rabbit, and how we perceive the world depends on our way of looking. So there are multiple perspectives about the same thing. And it is like when you read a book, you're reading the same words, the text is the same, but each time you can bring different meaning to it, and you get different meaning out of it. Even the scriptures that you read when you are a child or now when you are an adult, you get different meaning. So the words are the same, the meaning is different depending on our own maturity and the experiences that we have. So today, as you go through the entire day of yoga therapy retreat, we will all hear the same words, we will all see the same slides, we will all do, have the same handouts, the same practice, but each one of us will have a different takeaway, because it all depends on what we bring to the task. So in wrapping up, I will just say that the universe has presented to this planet a beautiful gift. You are the gift. So continue to take good care of yourself. There is only one you in the entire universe. So take care. And today you may have come here for many different reasons, such as, getting more knowledge out of this yoga therapy retreat, getting more information about yoga, or some of you may be, yoga teachers. You want to get professional development training, and some of you may be here for health reasons. But that is not the real reason. The real reason you're here today is because you love yourself. And when you love someone, you take good care of that person. And that is why you are willing to take one day of your life to spend for this yoga therapy retreat and go deeper into yoga, because you love yourself and you take care of yourself. Because when you are healthy and you feel good, you know that you can take better care of those around you. So enjoy your ride on this cosmic ball we call planet Earth, hanging around, floating around in the space. So, and also, I will just end with this slide that you can find everything in Google, but all you have to do is find yourself. Here is the takeaway from this, and these are the resources. You all have been given the resources. The two websites here, they take you directly to all the Patanjali Yoga Sutras. These are freely available online, and you can access all of the sutras with the meaning and interpretation. Thank you. Namaste. And if there are any questions, I will take any questions. Otherwise, we'll move on to the next thing.
I think for the sake of time, we'll progress. We'll go ahead and start our next session, and we'll reserve the questions for the probably during lunchtime, at the end of the day. So can you unshare your slides now, Abha, please? Okay, now you put on a speaker view. If you put on a speaker view, you'll be seeing me now. So Abha, thank you, Abha, for setting up our yoga therapy retreat. Now, as we said, we are going to present everything from the scripture. We call it authentic yoga. Now we'll start our practice, and you will see for COVID-19, what we have noticed, that a daily practice, what we do called dinacharya. In the morning, we do called ushapan. We sit down. See, this is the thing we do. First thing in the morning when you get up, we sit down in a malasana, sit down in squatting pose. We use a copper vessel. We keep the water in the copper vessel. We take and drink the water in gulp one at a time. It starts your peristalsis. So you get the first bowel movement in the morning. So able to have a first bowel movement in the morning, able to eliminate all the toxins. Think about it. This is a respiratory virus. I will present a lot more after lunch when I present a formal PowerPoint presentation, but here I'm going to show it to you. So all of them, even if they're on your mouth, entrance through your nostril, it is going to be flushed away with a daily called Ushapan and a first bowel movement. Next, you will see that all of our yoga practices are relaxation response, activation of the parasympathetic tone. Relaxation response is a parasympathetic, which is called calm and digest. So calm and digest, and what you will see after food, the food after proper digestion converts into 7 tissues called Saptadhatu, Rashadhatu, plasma, Raktadhatu, blood, Mamsodhatu, muscle, Medodhatu is your fat, Astidhatu is your bone, Majjadhatu, nervous tissue, and Shukradhatu is your reproductive tissue. From there, it goes into a substance called ojas. Ojas is our immunity. So the whole yoga therapy practice is a building of our immunity to fight with COVID-19. And also the daily practices, which we're going to show it to you right now, before we start our practice. We have a certified yoga therapist teacher, and we'll take about roughly little less than half an hour each. And I will show you some sitting down relaxing asanas. Dr. Sarkar Chakraborty will show you some standing asanas. Abha will show you the simple relaxing asanas, and then we'll do your yogic jogging. Ganapati will show you laying down asanas, and Aruna is another teacher who will show you your kundalini yoga. Now, in a daily yoga, after called Ushapan, we are brushing our teeth. And after brushing our teeth, all yogis do, we use a tongue scraper. Use a tongue scraper, these are the metal tongue scraper, all the way to the back and scrape it. Brushing doesn't help. So think about it. This COVID-19 virus is a respiratory virus. It is entering through your nose, entering through your mouth. It can stick to your tongue. You are removing it. In yoga and Ayurveda, there is plenty of tongue scraper. This is made of copper. Copper is very well used in your yoga community. We have very simple metallic steel. You can bend, so you can go in different angles. So tongue scraping is a must in preparing yourself before a yoga practice. Remember, in our scriptural yoga, it is not that you go ahead and start your asana practice, pranayama, and meditation. This is your daily routine. So after that, we do jalneti. Jalneti is a nasal washing. So think about it. If the virus is going through your nostril, if you're going to wash it regularly, the virus is not going to be there. So for me, people ask, oh, I have a flu, I have a common cold, I have COVID-19, can I do your jalneti? No, jalneti is a daily practice. I've been doing it for the last 20 years, or maybe longer. It doesn't matter. I'm in a plane, I'm in a train, I'm in a hotel, I do it. It takes only a minute to do it. It's interesting. So see, we use all that cup to say what we have. This is a very standard neti pot. This is a porcelain neti pot. You buy it, you put it in a little lukewarm water, then you put a little non-iodized salt. So you carry the non-iodized salt like me. I carry it it's called a TSA proof container, because when you carry something white in the plane, they get suspicious. So you get a TSA-proof container. I carry this antenna. These are all your non-iodized salt. Non-iodized salt helps you less irritation. Or you can have another, this is another very fancy looking neti pot. I have a bunch of neti pots. I have all the neti pots I have. What I have is that the one when I'm traveling, this is a regular plastic neti pot. It stays on this is my permanent fixture of my travel bag or on my toiletry. It is there. I use it. And a more fancier is, this is very common in India now. They use a copper neti pot. This is very, very popular. So with the neti pot, when you do the neti pot, you do a little bit of a few Kapalbhati pranayama. And then after neti pot, a yogic tradition is you do a oiling. It's called a abhyangam. You put an oil in the body and then take a shower before you do your practice. And I will show it to you. We also do one is called a sutraneti. This is a little red rubber catheter. We put it through one of the nostril. It comes out through your mouth. You're literally doing what is called a flossing of your nostril. So wonderful practice. You have to do it. What it does, it takes out all the irritations. So what it does, we call it voluntary control over involuntary function. Very, very important. I will show it to you all. Let me just show it to you, just a jalneti. See how to do a jalneti and how easy it is to do it. Okay, so I hope all of you are seeing it now. Just take a look at it. I'm going to use, generally we use the jalneti sitting down, preferably in a malasana. But here in West, we are in front of your bathroom. So we don't mind doing it standing up, standing up. So see how simple it is, and all of you should learn and all of you should do it. This is the neti pot I'm going to use. So the neti pot, I have a little lukewarm water, and I'm going to use that lukewarm water here to fill it up. Here is my lukewarm water. I'm filling up with the lukewarm water. Then I go ahead and use generally I use about 3 to 4 pinch of non-iodized salt. So take a look at it. Here I'm doing 1, 2, 3, 4. Putting a non-iodized salt. Stir it a little bit, and you'll see how simple it is. It's a fear. The fear is to go away. Initially, the water may not even come out because you are very tight, you are tense. It's all in relaxation response, all in relaxation practice. And in Abha said, in stages, impossible become possible. You will see how easy it is. Initially, it may not come out. So now what you do, you put it, I hope you're seeing, you put it in one nostril. Maybe I'll sit down, you'll be able to see better. Yeah, you put it in one nostril, breathe through your mouth, close your eyes, and slowly turn your head on one side. Then you just blow your nose. Remember, these are all your personal practices. So you do it on your own. I do it all in my bathroom. I have everything there in my bathroom. I just put it down a little bit so you can see better. Yeah. So I do it everything in my bathroom. I have a whole setup. So now you do the other side. In fact, when you blow your nose, you see all the gunk comes out, especially when I'm in India and I'm in different countries. Our nose is a filter. It filters all the dirts we are breathing. So let's put another, and you will do it both sides. Then I'll show it to you what you do after doing your Jalneti. Jalneti, very, very important. 1, 2, 3, 4. Very, very important practice for yoga therapy. Without Jalneti, you are not relaxed enough. You won't be able to do such a good asana practice, pranayama practice. And see how simple it is. Takes a minute. I'm talking, I'm doing, so taking a few more times, but just take a minute. Here is, I'm going to put the other nostril and see how easy it is. Closing my eyes, breathing through my mouth, turning my head, all the water is coming out. You blow your nose again. Then you need to do a few things. And this is the reason I show it to all of you. First, you got over with your fear. Now people say, it's not coming. You know, water knows you're very resistant. Water cannot get anywhere. Think about, you are dipping in a public pool. You don't know what is there in the public pool. You don't know who is even pissing in the public pool. Nose is very resistant. And then you see where you are. You are in New Delhi, the worst polluted city, probably in Beijing, probably in Mexico. You know, you may get something, but your nose is like a personal air conditioner. It warms up your outside air if it is cool. It cools it down, outside air is warm. Now, this is the yogic practice, what you need to do. After this, you stand up. After this, you stand up, and in a standing posture, what you do, you bend yourself. See, you have some water in your sinuses. So you need to remove those from the sinuses. You blow your nostril. Then do a Kapalbhati pranayama with different postures. Look high up. You'll see some water still coming out. This is normal. In fact, you might get it sometimes whole day. Look it down, do a 5 Kapalbhati pranayama. Look on the right side, do 5 Kapalbhati pranayama. Look on the left side, 5 Kapalbhati pranayama. In the frontal sinus, you hit 1, 2. So when you do this practice, this is a very important practice, and I like you to do it, and I like you to practice it. It's a very, very important practice. Okay, after this, you are going to do your practice. The most important practice in yoga therapy is going to be a relaxation response. And to establish the relaxation response, what you do, you will be doing in stages. I'm going to show you a few asanas, and then I'm going to show you how to bring the asanas in proper perspective before I hand it over to Abha in a few minutes. First, if you can sit down, you sit down. This is called a Sukhasana. Put your feet underneath your knees, keep your spine straight, and then listen to your body signal. Your first body signal is a pain. If you don't have any pain, you stay here. If you have a pain, you back off. Find the place where you don't have any pain. As Abha told you, ouchless practice. Annamaya kosha to pranamaya kosha. Any imbalance you create in the physical body, it will show up in your breath. If your breath is effortless, stay here. Then asana has the 3 stages. Arambho, beginning, which is the tightness of the muscle and ligaments. If you stay here a little longer, effortless breathing means breathing out longer than breathing in. Lungs is like a balloon. It has a 4.5 liter capacity, and we only breathe 0.5 liter. Learn how to breathe out first. You do longer, deep breath in effortlessly, breathe out. Slowly and slowly this thing will happen. This is called a sthiti, stability. Then you'll get into a profound level of relaxation, which is called a visarjan. Arambha, sthiti, visarjan. A wonderful stages of asanas. In yoga therapy, you are not mastering the asanas, you are using the asanas in stages for its therapeutic outcome. With my Jalati practice, I'm already in a total level of relaxation. In fact, you can use a hand mudras. Hand connects your body and mind. Use a Dhanu mudra or a Ganu mudra. Then keep your eyes closed. You do the breathing out longer than breathing in. You do some chanting. A, U, Ma, or do Om. You do pumping and cupping. Keep rubbing your hands. Keep rubbing your hands. So when you feel the warmth, if you're wearing glasses, you remove your glasses, take the hand, put it over your eyes like a cup. Let the eyes take all the heat. Massage your forehead, massage your eyes, massage your face, massage your ear, behind the ear, in front of the ear, inside the ear. This is called the auricular branch of the vagus nerve. It's called vagal stimulation. Massage in front of your neck is called carotid sinuses. When the carotid sinus get massaged, it's a vagal stimulation, massage in the back. When you incorporate all this thing, that is the yoga therapy. Yoga therapy is able to use the Yoga Sutra of Patanjali, Patanjali Ashtanga Yoga in a properly your adapted form for different yoga practices. Now see, I'm in such a level of relaxation. Next I do, I activate both sides of my brain. I change my feet, and you will see if you're practicing with me, you try it. You'll feel uncomfortable in one side, but the comfort will come back. Comfort will come back slowly. Next, what you do, I have a few minutes, and we have decided that we'll show you the different practices, because remember, every practice is a relaxation response. So let me get you next 7 minutes I have. So this is called Sukhasana or a Siddhasana. Take your heel all the way to the back. Take your one foot in the top, your knees will drop down. Say, even if it is here, you stay here. What you practice? Exhalation longer than inhalation. Exhalation is parasympathetic, inhalation is sympathetic. Use your hand mudras, even Adhi mudra, very powerful mudra. Use your chanting. This thing is going to happen on its own. This thing happens, always balance it to the other side. Siddhasana. From Siddhasana, you can do it's a very simple, Ardha Padmasana. Ardha Padmasana or Swastikasana. When you feel the level of comfort and relaxation, you do the other side. I'm doing it, I'm just showing you to the technique. What you need to do during practice, you do it in stages and do it very slow. So from here, you will do a wonderful Padmasana. Say, I would get into Padmasana because relaxation. But since I went stage by stage, I went with my Ushapan, I did my tongue scraping, I did my Jal Neti, I did my Abhyangam, I did my shower, and I came here. Yes, I did shower. I did put on a nice yogic outfit, and I'm here in front of you. You feel very light in your body and mind. You feel very, let's see, put your hand here, push it down, your whole body goes higher. Body goes high up and stays higher. Tolasana. It's wonderful practice, and you can stay up as long as you want. You don't feel the effect of any gravity in your body. Next asana, which is a powerful relaxing asana. Remember, a relaxation response is your immunity. Relaxation response is to fighting against COVID-19. Vajrasana. You sit down, Vajrasana. Most of you are very long-term practitioner, and you are practicing with me for a long time, so you know what it is. Sit down in a Vajrasana. People say, I cannot sit down, but do it in stages. Put a little bit of a folded blanket and go slowly. Here, powerful relaxation, Mandukasana. Adhi Mudra, at the level, keep your spine straight. Keep going down. Slowly come down, touch your head to the ground. Mundukasana. Wonderful practice. Another very Yog Mudra. If you do Yog Mudra, look at how beautiful Yog Mudra is. You get into your Padmasana. From Padmasana, hand in the back, look straight, keep your spine straight. Breathing out first, take a deep breath in, and always breathe in and out effortlessly. People ask me, when do I breathe in? When do I breathe out? No. In yoga therapy, you completely come down. Listen to your body say, no pain. Effortless breathing. You come all the way down. You stay here between 5 to 10 effortless breathing. You'll be doing it when you practice it. Beautiful asana. Vakrasana, Ardha Matsyendrasana, Gomukhasana. The whole body gets relaxed. Whole body has a wonderful relaxation response. Right foot comes next to your left thigh, right hand goes to the back, left hand comes outside, hand is high up, slowly comes, touches your knee. You breathe out first, take a deep breath in, and slowly turn your body all the way to the back. When you elicit this kind of relaxation response, that's what is going to fight your COVID-19. Remember, this is a respiratory virus. This is affecting your lung, creating inflammatory response. On the other side, so simply, and we'll go to the back. This is a wonderful asana for your chronic low back pain, your piriformis syndrome. Let me show you just 2 more asanas before I hand it over to Abha, who will guide you through your very gentle, relaxing asanas, followed by a yogic jogging. Wonderful asana is called a Vaisa asana. You put your one knee in the top. You feel a profound level of relaxation. You are so relaxed that you feel like that you are just a couple of minutes, Ava, will be done. You do a call Ardha Matsyendrayanasana. Wonderful for your turn your knee on the side, hand on this side, hand goes to the back, touches your knee, your ankle, and your feet. Deep breath in, slowly turn your body away from it. Final asana, sitting down, is your Gomukhasana. And you will see in Gomukhasana, your whole body relaxes. See, let me show you from the back so you'll understand what I'm talking about. This time, my right foot, my right knee is in the top of my left knee. Right hand is high up, left hand is in the middle, right hand comes down, it touches, hooks, it essentially handshaking each other. Look at that. It relaxing your hand, your wrist, elbows, shoulder, whole upper body, whole lower body. Relaxing your feet, ankle, knees, hips, and completely balanced to the opposite side. Now put the left knee on the top of your right knee. See me? Okay, yes. Put your left knee top of your right knee. Left hand goes high up. Right hand. You can always adjust. You can put your hand in the middle, and then you see it comes, it touches, it hooks, and essentially we handshaking each other equally on both sides. It's a powerful therapeutic asana. And also remember one thing, every time we're practicing this, we're practicing with this. This is our health tracker. This is our Apple Watch. I can see my heart rate, I can see blood pressure, see my EKG, everything when I'm practicing. So we will be glad to answer any question during lunch and during the end of the day. Because of a little shortage of time, I just want to hand it over to Abha. Then after Abha, we'll have a Shagana Chakraborty, Ganapati, Mainani, and Arunasharu. Abha, it's all yours now.
Okay, can you hear me?
Unmute yourself first, Abha.
Yeah, I did. Can you hear me?
Yes.
Okay.
Abha, you're still muted here.
But you can hear me because I'm using my iPhone.
You know, iPhone. Okay, okay.
I think it's better if you actually unmute the camera that you're using.
Okay.
No, then there will be two microphones. No, this is good. Ravi, then two microphones will clash. Should be using two microphones then. You are using your cell phone now, Abha?
Yes, and my laptop is on.
This is good. This is good. Keep this muted. Okay. Please proceed.
Yeah, if you can hear me, that's fine.
Yes.
Okay. All right, everyone. Very good. So like I said earlier, yoga is...
No, Abha, we cannot see you. We cannot, we just see your profile picture.
No,
You may have to turn it. We see you now. No, you have to turn on, you have to unmute so that you are in a speaker view, so we can see you.
okay.
Okay. Now we can see you.
All right, very good.
Yes, beautiful. Go ahead.
Okay, all right, so it's time for practice and everyone sit comfortably. We will do Sukshma Vyayam first, some light exercises, and then we'll do yogic jogging. So keep your back upright and straight, shoulders rounded back, and stretch your legs in front of you. So I think you should be able to see me if your legs are stretched. And we will start with the base. This is called the base position. Prarambhik Sthiti. This is the base position. Now, just spread your toes, move your toes, spread them and move them. Can you see? Yeah, just spreading and moving your toes. So we are going to do, pay attention to our major joints, starting with our feet. So wiggle your toes, move your toes, feel them, and then curl them inward towards the body and away from the body. So breathe in, move the toes towards the body, breathe out, away from the body. Now point your feet towards the body, pushing the heels outward. Keep your spine upright and straight. Keep your hands on the ground. And now point your feet away from the body. And as you point them away, you can feel the stretch in your legs. Now again, point your feet towards the body, push the heels outward. And you can feel that stretch on the underside of your legs. And one more time. And relax. Now, move them around. So roll your feet around. So what we are now doing is called Gulf Chakra, ankle rotation. So just moving both your feet around, then do it in the opposite direction, in the counterclockwise direction. Very good. And now bring some shoulder width distance between your feet and turn your feet in, your toes pointing towards each other. So your feet are kind of facing each other. It's an angular movement. Pretend you are holding this imaginary beach ball between your toes. So hold it, it's an angular movement. And drop the ball. Relax. Now bring your feet together and now press your kneecaps down. Feel the tightness in your legs as you're pressing the kneecaps down. This is called Janu Falak Akarshan. And as you hold your kneecaps down, you can feel the tightness in your thighs, in your quads, your hamstring muscles. Hold it tight, keep pressing the kneecaps down and relax, shake it. Very good. And now you can bend your leg and interlacing your fingers. You're going to hold your thigh and then lift your right leg up and down. And when you bring it down, don't let it sit on the ground. Let it be a little above the ground. So up and down, up and down. Last round, up and down. And now roll it around, just the lower half of the leg. So in this, you are addressing all the three major joints of your leg, your pelvic joint, your knee joint. Now do it in the counterclockwise direction, in the opposite direction. Very good, slow and steady. Now hold the knee still and just roll the foot around. Very nice. And then do it in the opposite direction. Great. And relax your legs, shake it off, catch your breath. Let's do the same thing with the other leg. So fold it, lift it, and straighten it. Up and down, up and down. Last round, up and down. Then roll it around, the lower half of the leg. And then we will do it in the opposite direction, counterclockwise direction. Slowly and mindfully. And then hold the knee still and just roll the foot around in one direction. Now do it in the opposite direction. Great, it feels really wonderful, especially in the morning here. Relax, lay your leg down, shake it off, catch your breath. And now we'll do Ardha Titli Asana. So you're going to first fold your leg. So you're folding your right leg. The sole of your right foot is touching the inside of your left thigh. And your left hand is resting on your right ankle. Your right hand is under your right knee. Breathe in, bring it towards the chest and away from the chest. So this is Ardha Titli Asana, our half butterfly pose. And we're going to slowly do this. Those of us who have been doing it for many years, you can go to the next step, which is you can lift your leg and put it over your left thigh, and then you can move your knee up and down. And what will happen slowly with practice, initially when we started, like our knee was up here and it wasn't going down. Do not wrestle with your knee. Just take your time And with practice, it will slowly open up. So initially it was here. With practice of few years, slowly it begins to go down, and before you know it will be all the way down. So you start with the foot down, and then you cross it over, and you go in stages. Relax, stretch your leg, shake it off, catch your breath. Let's do the same thing with the other leg. So you're going to fold it. Your right hand on your left ankle, your left hand under your left knee. Breathe in, bring the knee towards the chest, and breathe out. So this is how you are working on your pelvic joint, the hip joint, one of the hardest joints to relax. Last round, and then you can even cross it over if you want. You can put the left foot over your right thigh and then go up and down. Do it at your own pace and listen to your body and relax. Straighten it. So that was Ardha Titliyasana. Now we'll do the full butterfly pose. Titliyasana. So fold both your legs. Bring the soles of your feet together. And you can feel the stretch in your thigh muscles. Now interlacing your fingers, you're going to hold your toes and flap your knees up and down. Yes, very nice. This is Titliyasana, also called Baddha Konasana. So keep your spine straight, and it is so relaxing, especially when you do it with your eyes closed. You can just be one with this asana. And this yoga mat is our magic carpet. So when you are here, you be totally here. And you just then forget about all the rest of the things. You're totally present. Now relax your legs. And let's bring our attention to the joints in the upper half of the body. Stretch your legs. Not your legs. Stretch your arms straight in front of you. Feel the full stretch. Initially, the elbows may be slightly bent, but slowly you can straighten it. Now spread your fingers wide like a starfish. And then make a tight yogic fist with your thumb inside. Hold it tight. Then open it and close it. This is hand clenching. This is called Mushtik Bandhan. Now you make these fists and you roll them around. So working on the wrist joint. This is all to prevent, arthritis or delaying the onset of the arthritis. Now do it in the opposite direction. If you keep doing it, your joints will be healthy. Now open your hands and lift your palms up, straight, and down, straight. This is extension, hyperextension, flexion, very good for our wrist joint. And this is wrist bending. It's called Mani Bandh Naman. Now alternately move them up and down. So can you see it? Up and down, alternately. Very good. Now open your hands and touch your shoulders. Open, so your hands are facing up, and fold. Open and fold. Last round, open and fold. Do it sideways. Open and fold. Very good. Open and fold. Last round, open and fold. This is Kehuni Naman, folding our elbows. Now drop your elbows down and roll them around. So breathe in as the elbows go back and breathe out when they come to front. So let's do it one last round in this direction. Now we will do it in the opposite direction. So remember, slowly we are addressing one by one all the major joints in the body. There are more than 360 joints in the body. So here we are addressing those major joints, and now relax. Let go. So that was, and now we're going to just roll the shoulders around. Breathe in as the shoulders go back and breathe out as they move to front. So you're doing it at your own pace. You're not just moving your shoulders up and down, you're moving them in a circle. So breathe in as the shoulders go back. This is called Skandha Chakra Asana. This is shoulder rotation. And now do it in the opposite direction, counterclockwise direction. Very good. and it's very relaxing. You can feel the muscles right below your neck relaxing as you do this. All the tightness in the body begins to melt away and relax. Shake it, catch your breath, and now holding the two wrists. So with your right hand, you're holding the left wrist. With your left hand holding the right wrist, you're going to raise your arms up and then bend it to one side. And when you bend it to one side, don't rest your arm on the head. Keep your arm behind your head. And feel that stretch. You can feel the extension of your spine. You can feel the stretch on your back. Then straighten it and come to the center. Breathe in. And as you breathe out, bend to the other side. And feel that full stretch. It feels great. Bring it to the center. Relax. Bring your hands down. Shake it. Catch your breath. And now the big joint, that is our neck joint called Brahma Mudra. So, and you always do it while sitting down. So keeping your spine straight, hands in Gyan Mudra or Chin Mudra position. That is the index fingertip joined with your thumb tip. Rest of the fingers are straight. And rest your hands on your lap. Breathe in. And as you breathe out, gently drop your chin down. Let your chin sit on the sternum. Feel the stretch on the back of your neck. Then slowly lift your chin up and gently drop your head back. Feel the stretch on the front part of your neck. Now bring your head to the center and turn your head to the right. So the chin is now parallel to your shoulder. It's like you are looking over your shoulder. And then slowly bring your head to the center and now turn your head to the left. So now your chin is parallel to your left shoulder. Then slowly bring your head to the center and tilt your head to the right. So now your right ear is closer to your right shoulder. Don't lift your shoulders up. Keep your shoulders at the normal level. Feel the stretch on the left side of your neck. And then bring your head to the center and gently tilt your head to the left. Now you can feel the stretch on the right side of your neck. Your left ear is closer to your left shoulder. Bring your head to the center. And now very slowly and mindfully drop your head down. And then you're going to roll it around very gently. Do 2 rounds in one direction and we'll do 2 rounds in the counterclockwise direction. Do it slowly. At any point, if you experience pain, you need to cut back or just stop. And when you finish your 2 rounds in one direction, don't forget to do your 2 rounds in the opposite direction. It's very relaxing. Because there are major arteries, veins, nerves going through the neck, it is always recommended that you do it while sitting down. And then slowly you can open your eyes and it's just so relaxing. You feel great. You know, now your joints have opened up and we are ready to move on to yogic jogging. So you're going to stand up and it's time to move our body. Like I said, you know, yoga is 95% practice, 5% theory, and talk. But here we are. So everybody stand up, and we'll begin our yogic jogging. It consists of 12 steps. Step 1 is spot walking. So in your own spots, begin to walk. Walk, walk, walk. Yes. Very good. March, march, march. Let your body charge and march, march, march. This is great. Everybody, you're slowly opening up and warming your muscles of the body. And then allow your arms to swing and allow your heels to kind of touch your hips. You're not going to kick yourself too hard in the back, just doing it gently. This is step 2. Step 3. Bring your hands towards at your waist level. You can start low and then move your legs. So you are touching your thighs with your palms. You're not moving your hands. Your hands are still. You're simply moving your legs. Yes. Don't move your hands. Keep your hands still. Start low. You can then slowly raise the bar. I know there are some of us, they have their hands up here near the shoulders and they're raising their legs all the way up towards the shoulder. So just start where you are comfortable. This is step 3. Step 4, hands at the waist. We'll do a standing squat. Feet apart. Keep your spine straight. Breathe in. And as you breathe out, you're going to bend your knee. So your feet are slightly at an angle. They're not facing front. They're slightly at an angle, about 45 degrees angle. And your knee is parallel to your toes. So don't point your knee towards the front. Your knee is parallel to your feet. And stay there. Initially, you will notice that you're leaning forward or you're leaning back. Slowly, you will have a straight back while you bend your knees. You can feel the pressure in your thighs. You can feel it in your calves as you hold it. Hold it. Very good. Slowly come back up. So that is the standing squat. And now we will spread our legs a little further apart. Put both your arms in the front. So stretch them with the palms facing down. Breathe in. And now slowly turn your hands to the right and bend your right knee. So you are stretching your left leg. Your right leg is bent. Your hands are parallel to your foot. And stay here. You can feel the pressure on your right leg where you are bending. You can feel the stretch on your left leg. Initially, you will notice that your left heel is up. Slowly, you'll be able to bring your left heel down. Bring your hands to the center. Breathe in. And now turn to the left side slightly. And now you're going to bend your left leg. Keep your gaze parallel to your hands. Feel the stretch on the right leg. Feel the pressure on the left leg where you're bending. Hold it. And slowly bring your hands to the center. Drop them down, shake it, catch your breath. And now we'll do a lateral bend. So you're going to keep your hands at the waist with your fingers pointing behind. Your thumb is pointing front, right? And now you're going to turn both your feet to the right. So now you're looking at the right side. Breathe in. And as you breathe out, you're going to bend your right knee and then slowly tilt your head back to look up towards the ceiling. But if you have any neck problems or cervical issues, then keep looking straight ahead. Stay here. We try to stay in a posture for a round of 3 to 5 breaths and slowly relax. Face front, catch your breath. Let's do the same thing on the other side. So now turn to the left side, breathe in. And as you breathe out, you're going to bend your left knee and slowly you're going to tilt your head back to look up towards the ceiling. Hold it here and relax. Lateral bend. Now bring it down and now we'll do another side bend which is very similar to triangle pose that you'll be doing later on with Dr. Sarkar. So breathe in. And as you breathe out, you're going to slide your right hand down towards your right leg by lifting your left hand up. And you can tilt your head to look up towards the ceiling. Then come back. Then slide your left hand down your left leg and lifting your right arm up. And relax. These are just warm-up movements. So you're just stretching right now. Opening up and relaxing those muscles so that the tightness melts away. And now we will do forward and back bend. Now with forward bend, remember if you have severe back problems, do not do forward bend. If you have hernia, do not do back bend. Breathe in, lift your arms up and bend back. And you're bending at the waist. Slowly breathe out and bend down to reach the ground with your hands. Now, if your hands don't touch the ground, that's okay. If your hands reach here, you stay there, wherever your hands go. Breathe in, hands up, breathe out, hands down. So just do it a few times, up and down at your own pace. Last round. And relax. Catch your breath. And now we'll do the chest opening pose. Stretch your arms in the front, breathe in. And as you breathe out, open your arms wide, pushing your chest forward, tilting your head back. It's like you are welcoming the universe and you are ready to take on the world. Hold it here. It feels wonderful. And relax. Bring your hands to the front, drop them down. Shake it, catch your breath. Keep the distance between your legs. We are going to do crisscross. So with your right hand, reach for your left foot, then come back. With your left hand, reach for your right foot. Again, take your time and listen to your body. Let's do a few rounds. And if you need to bend your knee, that's okay. Last round. And again, if your hand doesn't reach your toes, that's okay. Always listen to your body. Drop your hands down, shake it, catch your breath, bring your feet together. And now we'll do jumping jacks. We will do low impact. So spread your legs, hands at the shoulder level, and bring your feet together, hands above your head. So shoulder down, shoulder up, shoulder down. This is great. This is like PE exercise, you know, the physical exercise we do in school. Last round we are doing like this. You can also do up and down jump if you want to ramp it up. Or just keep doing low impact. So low impact is up and down. Now we'll do up and down. Up, legs apart, hands above your head, bring them down, feet together. Up and down. Up and down. Yes, very nice. And relax. And now swing your arms from side to side. Just letting go of that tightness. You know, just powerful. It's a powerful spinal twist. Just letting go of any stress, any strain, any stiffness. And now your body is warmed up and it's ready for the rest of the day. So thank you, and we'll move on to the next step. So I'm handing it over to you, Dr. Sarkar.
Okay, thank you. Thank you, Abha. Thank you, Abha. Can you put yourself on mute now? So we'll see Shadhana. Mute yourself now. Okay. Our next presenter will be Dr. Shadhana Chakraborty. He's a retired family practitioner, certified yoga therapist, and have been teaching us for a long, long time. Thank you, Abha, for see how she did a beautiful relaxation response, preparing your body. Now, Dr. Chakraborty will show you all the standing poses and primarily what is the basis of yoga practice, your Surya Namaskar and a Chandra Namaskar, sun salutation, moon salutation, and the standing poses. So, Dr. Chakraborty, it's all yours now.
Can you hear me? Can you hear me? See me?
Yes, we can hear you, and there is a little echo. Okay, go ahead.
Yeah, this room is full of echo a little. So, but you can hear me, right?
Yes, you can speak a little louder. So, okay.
Okay.
Go ahead and start.
So-
We can hear you.
Okay. So I'm going to do standing poses. I'm too old to make it pretty, but it will be tolerable. So as Dr. Sarkar said, we'll start with Surya Namaskar. Surya Namaskar has 12 steps, and you can do it with mantra, with praises that 12 different attributes of the sun. So as I'm doing it, Mita will chant mantras, and then we do 2 sets. During the second set, she will translate it in English too. Okay, so Surya is this way. I'm going to start like this. So first, Namaskar.
Om Mitraye Namaha.
Then Hasta Uttanasana.
Om Rabhaye Namaha.
Then Pada Hastasana.
Om Suraye Namaha.
Then horse riding pose.
Om.
Hastasana.
Om Bhanave Namaha.
Then Parvatasana, mountain pose.
Om Khagaye Namaha.
Then Ashtanga Namaskar.
Om Pushne Namaha.
Then you have Bhujangasana, Cobra pose.
Om Hiranye Garbhe Namaha.
Then back to Parvatasana.
Om Marichaye Namaha.
Then back to Astasanthalasana.
Om Adityaye Namaha.
Then back to Padahastasana.
Om Savitri Namaha.
Then back to hand rising pose.
Om Arkaye Namaha.
And back to Namaskar Mudra.
Om Bhaskaraye Namaha.
I'll do another set, and this time she will chant it in English. And remember, each step you breathe in, and the next step you breathe out. So we breathe in here.
The friends of all, the praised by all, the guide of all,
Then we put the left foot to the back this time.
the bestower of beauty,
Then the right foot to the back for Uttasana.
the stimulator of all,
Then knees, chin, and the chest on the floor.
the nourisher of all,
Then raise your upper body.
the creator of all,
Then back to Parvatasana, hips all the way higher.
the destroyer of disease,
Then the left foot to the front, horse riding pose.
the inspirer of all,
Then right foot to the front, Padahastasana.
the purifier of all,
Then hands all the way higher.
the radiant of all,
Then back to Namaskar Mudra.
the illuminator of all.
Now I will do Chandra Namaskar. Surya Namaskar is a hitting pose. Chandra Namaskar is supposed to be cooling pose, and you do it gently. It has many steps. We don't do it with mantras this time, but I will go through. I usually use the right foot movement first, and then the left, just like I did it in Surya Namaskar. So Chandra Namaskar starts with Namaskar, then hands up, then you put your hands down next to the feet, head touching the knees, then you squat. Then you put your hand next to the feet, and the right knee goes to the back, hands up, hands down, left knee goes to the back, hands up again. Then you put your hands down on the floor in child's pose. And then we do Bhujangasana. Don't forget to breathe in and breathe out in each step. Then back to child's pose. Then we get our hands up, hands down, right knee to the front, hands up, hands down, left knee to the front, squat, then hands next to the feet, head touching the knees, and all the way up, and back to Namaskar Mudra. So again, I'll change sides just to give a different look. So start with Namaskar, then hands up, Hands next to the feet, head touching the knees, then squat. Then hands next to the feet. This time left knee to the back in the first time. Then hands up, hands down. Right knee to the back, hands up again. Then we lie down in child's pose. Then we do Bhujangasana. Then we just keep going back to child's pose. Then hands up, hands down, left foot to the front, hands up, hands down, right foot to the front, squat, hands next to the feet, head touching the knees, hands up. Perhaps I went too fast, but you get the idea because I did 2 sets. Next we'll do Tadasana, mountain pose. It's hard to translate Sanskrit yogic words in English, but mountain pose. So we raise our hands all the way higher, and as Abha already said, you try to do it for up to 5 breaths or maybe longer. So breathe in, breathe out, breathe in, and then breathe out twice as long as breathing in. Okay, then you can put your hands together and turn to one side. As far as it goes, stay there again. 5 breaths. Breathe in and breathe out twice as much as long as breathing in. Then come to the middle and go to the other side. And keep your feet together and hands together just like I'm doing it right now. Again, stay 5 breaths if you can, and then come back to the middle. Then we will do Utthita Padasana, Utthita Tadasana, where you do the same thing, keep your hands up as if somebody is pulling it from the ceiling, and then you stand on your tippy toes. Again, if you can, breathe in and breathe out 5 times, and then you come down. Okay. Now I will do a few balancing poses. I'll start with tree pose, Vikrasana. Before I start, let me tell you about balancing poses. It is said that people who can balance, they have it's a sign of good health, and not only good physical but emotional and spiritual health. And of course, we are talking about COVID-19 now, and you need emotional and physical health to combat any disease, definitely to combat COVID-19. So, tree pose, you can see what I did. You could put your foot top of your, not on the knee, above the knee, and get your hand up. Again, you breathe in and breathe out 5 times if you can, and then get your hands down, and now you can do the other side. Same thing. Oh, I forgot to tell you, you can challenge yourself and close your eyes. And it works better if you focus away as far as away as you can. All right. or you could come down like this. Now I'll do another balancing pose. Balancing poses again are very important part of asanas. When you are doing asanas, think yourself as you are the universe. You are as big. If you close your eyes, you will see yourself covering up the whole universe, and that calms you down. And you focus on what you are doing, that also calms you down. So this is not a Rajasana, but dancer's pose. And again, you hold one ankle with your one hand, and the other hand you raise, and you just go down. Get your upper body down, horizontal, sorry. And then you do the other side. Again, try to stand on one pose for 5 breaths. Sometimes when you are demonstrating and thinking what to say, balance goes off, but anyway. So balancing poses needs concentration, and if you are off concentration, sometimes it's hard. All right. Now another partly balancing, partly stretching poses are Virabhadrasana, warrior pose. So I'll be doing 1, 2, and 3. I will tell you as I'm doing 1, 2, and 3. So first we'll do 1. Okay. So I want to start like this. Then get your hands up. Then turn your one foot perpendicular, then one foot angulated about 45 degrees. And then you go that way and bend your knees, bend your knee, and go up, and then get your body bent as far back as possible, and stay there for 5 breaths. Okay, then get up and do the opposite direction. Remember, all these poses have lots of variations. I will probably doing one variation, and other people may do others. We'll do the same thing, get your upper body as far back as possible. And again, try to stay with 5 breaths. Okay, that was Virabhadrasana 1. Now I will be doing Virabhadrasana 2. So I'll start the same way. Then this time I will open up and then bend one knee. Get one foot parallel to you, and the other foot perpendicular to you, and then bend that knee and go like this. So go that way. I was just kidding that you could go like this. Some people will go like that. Some people will go like this. And some people will going like this. But it doesn't matter, just do what you do. Again, 5 breaths. Then you come back and put that foot perpendicular to you, other foot parallel to you, and then go down and look towards the hand and stay there for 5 breaths. And just come back. So that was Virabhadrasana 2. And I will do the 3. It's pretty similar. Okay. Go like this. And then this time I will do this side. So get your foot parallel and this foot across. Then instead of going that way, you go like this. Bend your knee again. And then stand on that foot and get your upper body parallel to the floor and your leg parallel to the floor if possible. And stay there again for 5 seconds. Come 5 breaths, come back down. Go like this. Do the other side. Same way, this foot perpendicular, this foot parallel. Bend your knee. Go that way. And then get up. Again, this is a balancing pose. If you are not focused, if you are thinking what to say next, you will be a little bit off. All right. Then I will do a couple of twisting poses. One will be Chakrasana, and other one will be Trikonasana. I think I'll start with Trikonasana. Trikonasana. Time. We get your one foot parallel, other foot perpendicular to your body. Go down, and then, as I've already showed you, you go down and 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 down. Pretty soon you have to make a hole on the ground if you can go further down. And then you look at the thumb. You can stay there for 5 breaths. And so I kid always that if you don't have to stay there too long, breathe fast. All right. And then we do the other side. Again, keep going down. You can start with your knee and just go down as far as you can go down. Always stop. When you can't do any further, don't go beyond yours. And let your body tell you. Like right now, I woke up with a bad neck, so I'm not turning my head all the way up because I don't want to bother my neck. Again, stay with 5 breaths. And then come down and keep your feet slightly apart. I'll do another twisting poses. By the way, your thoracolumbar spine, you can do 3 pure movements. One is touching the forward bending that we do several times during our Surya and Chandra namaskar, so I won't do that. And then you can twist. And you can do side bending, which I already did. So now I'll do the twisting. Again, keep your hands up, and then put one hand next to your back and one hand on your shoulder. And whichever hand is touching the shoulder, you turn your thoracolumbar spine that way. I prefer that you don't bend turn your neck also, because this way you can focus only on your upper and lower back and not on the neck. So turn, and again you can stay longer as long as you want to, but at least 5 breaths. So then you can open and do the other side. All right, open back. Okay, I'm going to do a few standing and then sit down poses. Some of them are really tough, but I hope I can do it today. All right, so first one will be the squat. And you can put your elbows next to your knees and push against your knees and breathe in and breathe out. This time I'll do it 5 breaths, but again, this is pretty good also balancing pose, and also it's a sign of good health if you can do these. So anyway, I'll do 3 times. All right. Now let's do cross-legged. Sit down. Please don't try this if you are not sure, because you can hurt yourself. Or you can also do by using one hand on the floor. What time is it?
53.
Okay. All right. Okay, the other side is always tough. We try this at least one time. Again, be very careful. One time is good, so let's do it twice. Oh, getting greedy now. We'll do it 3 times. All right. I will show a couple of poses which are not standing, but I think Dr. Sarkar wanted me to do it. Since we have a couple of minutes, I'm going to do those. First will be Bakasana. Bakasana is crane pose. Takes a little practice, but you can do it. So put your hands on the floor like this. Then you can put your elbow in between the crease of the knees, or if you're a little more advanced, you can put the elbow under your knees. And then just lean forward. Okay, just lean forward, don't worry about lifting your feet up, and when they come up, it's fine, let them come up. All right. Again, these are not standing poses, but I have a couple of minutes, so I'm doing it. All right, then next is Mayurasana. Mayurasana is same way, except it's other way, and the hands are a little closer together. So you can put your elbows on your chest. Same thing. Just lean forward, don't worry about lifting your feet off the floor. When they come off, that's fine, let them come off. Okay. Last one I do is Mayurasana. It's the same thing except you do it with Padmasana. All right, so Padmasana, and you do the same thing as Mayurasana. Get your hands backwards, get your elbows on the chest, lean forward, and if your knees come off, that's fine. If they don't, just keep trying every day. All right, I think my time is almost up. So I will give it back to Dr. Sarkar.
Okay. Thank you, Dr. Chakraborty. Can you go ahead and mute yourself so that we can see the next speaker? Go ahead, mute yourself. So now you have seen what our Dr. Chakraborty has shown. What he has shown to you and between Abha is that you are not trying to practice so-called difficult asana. There is nothing called difficult asana. You know, Bakasana, Mayurasana, Mayuriyasana, Shirshasana, headstand, this will come to you when you prepare your body in stages and in relaxation response. Another thing what Dr. Chakraborty has shown, and even Abha has shown gradually, that getting up, that unassisted, you are sitting here, from here, if you're able to get up without a support, this is a sign of your health. This is a sign of your body's immunogenesis. There is plenty of studies. You guys can look at your PubMed. PubMed is the website for your National Institute of Health, and you will see a multiple article on the unassisted getting up. About a Brazilian cardiologist looked at 3,000 patients, and it is a powerful your prophylactic cardiology. It's a powerful marker of your health. Then what he says, when you want to get up, if you put your one hand to get up, you lose 25% of your health. If you put two hands to get up, you lose 50% of your health. And if you use 2 feet and one leg, you lose 75% of your health. And always try to balance it, what Dr. Chakraborty was showing. If you can get up from here like this, you will always cross your leg. So if you can get up from here also, practicing it. It's wonderful practice. Our next presenter will be our Dr. Ganapati Mainani. He's a physicist. He works in the Jefferson Lab, and he understands quantum health, and he understands real yogic philosophy. Remember, what we are presenting to you today, everybody asks us, what kind of yoga do you practice? Our answer is both yoga and Ayurveda. The root source is a Veda, and we present it as it is from the scripture. We do not dilute any of the tradition. So again, here I present Ganapati Mainani, who will be presenting you the laying down asanas, both supine and prone poses, and then he will also show you some advanced asanas. Ganapati, we are going to mute. Let's see where you are.
When I started, I thought I was not muted, but you can hear me now. I unmuted myself.
Yes.
Let me increase the volume a little.
Okay. So, sorry for the noise behind. You can hear me now, right?
Yes, we can.
Okay. All right. I'll start with the lying down. Put your left hand down and put on top of that your right hand.
Ganapati, we cannot see you. You need to tilt your camera down. You need to tilt your laptop. We are seeing all in the upper. Yes. Thank you.
Can you see me now? Yes, I think so. There's something on the screen. Can you take it off, Ravi?
Yes. Yes.
Okay. Yeah, the basic thing in doing this asanas is one needs to relax into a position, pose, and take deep breaths up to at least 5 to make the body comfortable in the asana.
Ganapati, can you speak up a little louder? Little louder, speak up.
So basically, I'm lying down so I can lift my head up to the computer. Can you hear me now? Yes? Hello?
Yes. Yes.
Okay.
But just keep your volume a bit high so that it comes through clear.
Keep your volume up highest in your laptop.
Yeah. Or move closer. That's great.
Your input, audio input, put it all the way up. Volume up. Thank you.
There's still something on my screen here. Let me close it off. Okay.
You'll go to your settings. You go to the sound, audio, input, highest volume. That's it.
Sorry, it's not showing up.
Okay. I think we can still hear you good enough.
Okay, let me now. I know I got
Yeah.
it.
Try one time. If not, just go ahead and proceed.
Okay, I raised it as much as I can.
Okay. Thank you.
Yeah.
You-
Okay, so sorry for it's the first time I'm doing my Zoom presentation. So rest on your head on your arm, and then I would like to turn my head to the left, or actually to the right, and rest my head so that I'm actually giving some nice twist to my neck. Rest here about 5 minutes. Sorry, five breaths, deep breaths. Then come back to the center. Turn this time to the left and rest your head on your hands and take deep, relaxing breaths. So you are giving some nice twist to your neck. And then come to the center and let us go on our hands like this. This is called a TV viewing pose. I think Dilip, you can tell the Sanskrit one for this.
It's a modified Makarasana. You know, same Makarasana.
Yes.
Yes, it's a modification of the Makarasana.
And then your legs are up behind, your feet are together, and slowly raise your right foot up close to your buttocks and bring it back. Next, your left foot up, left leg, the foot is close to your buttocks. Do this about 5 times on each side, right, left, right, left, right, and left. Now let us do both legs at the same time. Lift both legs up, down, up, down, up, down. Last time, both legs up, close to your body, back. Then relax.
Ganapati, Ganapati, can you hear me? This is Dilip. Can you do it on the sideways so we'll see a little bit better? You have enough space? Yeah, yes. Now we'll be able to see a lot better. Thank you.
Okay. Now, bring the distance between your feet and your both palms are next to your ears. And Bhujangasana. So basically, this is the Bhujangasana, cobra pose. And take nice breaths here again. Relax into the pose. And take 5 deep breaths. Relax and come down. Now we're going to do period Bhujangasana. Come up and twist your head and look at your right foot. So again, relax into this position and take deep breaths. Relax and come back. Now the opposite. Come up and twist your neck around. Look at your left foot. Relax into this. Come back. And next we are going to do, what is this called? Dilip? Raise both your feet up and also raise your head. Make yourself if possible parallel. Relax and rest in this position. Take deep breath. Come down. Next, we are going to go into the Dhanurasana, bow pose. Bend both your legs and hold your legs with each hand, respective hand. Take a deep breath and come up. Push your legs back so that your hands are stretched. Take a nice deep breath. Relax. So I think next I'm going to go on my back. I don't think I have room to do it. Maybe you'll be able to see this. First is a stick pose. Raise your hands and place them behind your head and bring the both feet together and stretch the foot. Relax here. Now let us raise our right leg and right hand, bring them parallel to each other. Relax here. Relax and bring them back to the floor. Next, we are going to raise left leg and left arm, make them parallel to each other. You can see these clearly this time. If you go too far, you just going to shake. You don't want to shake. So come back. And next we are going to do both. Relax and take deep breaths. And then bring the foot facing each other, touching. And relax here again. Next, bring your foot very close to your head. Relax. Bring back the head a little bit and then go to the right and left. Relax. Next, we are going to do it's called Pavanamuktasana. For this, we are going to raise both legs up and take your hands and put behind the legs and bring the legs close to your chest. Knees close to the chest. Put it here. Relax. Settle into the asana. Take a deep breath. As exhale, bring your head close to your knees. So we can turn this way a little bit for this. And then go to left, right, right, left, right, left. Relax. Up and down, up and down, up and down. Okay, next I'm going to do something called Nauka Asana, boat pose. For that, Okay. Next, we are going to do Matkasana. It's a monkey pose. Put your hands and for your legs. Take a deep breath and push the legs to the right and turn your head to the left and watch the palm of your left hand. Relax into this. Take deep breaths. Relax and come back to the center. This time to put your legs down to the left and put your head to look at the right palm. Okay. Come back. We are going to do another one. A little bit. Bring a distance between the feet and bring the feet to the right side and look at the left arm here. The left knee is sitting very close to the right foot and right knee on the ground. Relax and take deep breaths. Come back to the center again, and this time we're going to put the left foot, left leg down, and the right knee is close to the left foot, and left foot is touching the ground, and we are still looking at the right arm. Again. Then the main important thing is taking the breaths in each asana. Relax. Straighten your right leg and take your left leg up and place it very close to your right palm and turn to the left and look at your left hand. Again, relax. Take deep breaths. Relax, come back. Stretch your left leg and raise your right leg up and bring it close to the left arm and turn to the right and look at your right. Okay, come back and relax.
Damn, homie.
All right, what is the next one we are going to do? So we are going to do the we are going to do the bow pose. With inversion pose. Relax and raise your right leg up. Relax. Bring the right leg down and this time Raise the left leg up. Relax, knee down. Okay, next I think we are going to do raise both our legs up.
Nice.
And then down. Let us do the Dvichakrikasana, which is a bicycle pose. Slowly rotate your legs like you are pedaling a bike. And you can do it in the reverse. Next, we are going to do the leg rotations. For that, raise both your legs up, and maybe you want to put your arms under your hips to get a little lift. Rotate the legs nicely, about 4 times in one direction. And in opposite direction.
Control. Work those obliques.
All right. Next, we are going to do the shoulder stand. Hold your both legs, raise. Again, relax into this. So let us go into a flow. Relax. Let it come down. I think that's all. I think.
This is Dilip. Do you want to do your favorite one?
Headstand I haven't done for a long time.
That's okay. And then why don't you Ganapati, do a Shishasana, then do a little Savasana. Finish Shishasana and a Savasana, you finish.
Yeah, that I haven't done Shishasana for a long time.
It's okay. You are pro.
Well, I had to practice to stay longer.
That's okay. Just do a little Savasana and finish it.
Savasana is basically, relax, lie down, with palms facing the sky and the feet relaxed. Close your eyes and take deep breaths. Well, I haven't tried this in this room very well for making this presentation, but anyway, looks okay, I think, anyway. Well, I can do this. So. Namaskar. Sorry, Dilip, back to you.
Yes, now you go ahead and mute yourself now. So you'll be able to, we'll have to go to the next speaker.
This.
Okay, now all of you, you are still not muted, Ganapati. Are you muted? I don't. Ganapati, are you muted? I don't see myself on the speaker view. Ravi?
Your video is not showing right now.
My video is not showing. Okay, let me see. I turn on my video. Okay. But I'm going to message here.
There you go.
Okay. What does it say? The co-host start. Okay. Now, all of you, I'm sure, who's practicing with us, you have seen how easily all of our teachers are practicing. See, when they're doing, you call it a most difficult asana, Sarvanga asana, shoulder stand, Shirshasana, headstand, they were talking, they're even singing. This is what is called a effortless ease. Abha was mentioning at the beginning. So think about that. Dis-ease, all the disease are called dis-ease, D-I-S space E-A-S-E. So the therapy for all the dis-ease, yoga therapy, is called an effortless ease. You'll be doing all the asana practice, pranayama practice, you'll be doing all the jal neti, sutra neti as if effortlessness. Our next presenter is Aruna Sharup. Aruna is a long-term yoga teacher. She's a certified yoga therapist. She's a certified kundalini yoga instructor. So to change a little bit of a perspective and give you a little new flavor, she's going to give a demonstration of kundalini yoga. Thank you, Aruna. It is all yours now. I'm going to put myself on a mute and you start in a speaker view.
Can you all hear me? All right. I'm on now. Thank you for letting me teach Kundalini Yoga today. So Kundalini is a pure awareness. I just wanted to let everybody know. And then the Kundalini Yoga is a technology to awaken your awareness and take you into yourself. So first we rub your palms, and this is actually, the teachings are from Yogi Bhajan. So I'm going to place my palms towards the chest, pressing the thumbs towards your sternum. Inhaling, connecting to the golden chain of gurus and devas. So inhale and suspend your breath. Exhale. And we'll tune into Om Namo Gurudev Namo 3 times. Inhale. Om Namo Gurudev Namo Inhale again. Om Namo Gurudev Namo. One more time, take a deep breath in. Om Namo Gurudev Namo. Inhale, suspend your breath. Fields around you. That is your consciousness. And exhale. Let's slowly coming to the cat and cow, just gentle warm up. So we are coming to the cat and cow. Less than a minute. What we're going to do, keep your hands shoulder width apart, knees hip width apart. Keep your toes together, heels together. Inhaling, chin up, chest up. Exhaling, curving your back. This is cat and cow. When you inhale, you bring your chin up, chest up, and exhale, curving your back, tuck your tailbone under. So first you start slowly, and then you start with your own pace. You can increase the pace. So first you just gently focus on your spine, and then you can close your eyes and just focus on your breath. Inhaling, chin up, chest up. Exhaling, curving your back. And this is actually increasing the, moving the spinal fluid in your spine. You can, if your eyes are closed, you can imagine, you can check with your spine how it is flexing up and down. And you can deepen into this practice. And then maybe last 10 seconds, we can increase the pace. So just do the breath. Inhale and exhale evenly. Now inhale, chin up, chest up, tailbone up. Hold your breath. Focus on the third eye. Tighten up your glutes, navel. And then slowly exhale. Exhale completely, breathe out. And then tighten up your glutes, navel, and sex organs. It is called root lock, or you can call Moola Bandha. Hold your breath. And slowly release, coming up. Inhaling, sitting on your heels, inhaling, arms up. Raise your arms over your head, palms together, crossing your thumbs. And exhale, keeping your spine straight, arm beside your ears. And slowly bring your forehead down to the mat. This is also called Guru Pranam. Inhale and exhale. And slowly come up, keeping your spine straight. And exhale, bring your hands down. So today we'll do the set for Nabhi Kriya. Nabhi Kriya is the navel, the third chakra. The third chakra is if you draw a line, 3 fingers below your belly button. If you draw a line from your navel, from the 3 finger below the belly button to the tailbone, that center of that line is the third chakra. So we are going to focus and use the navel point energy. So let's lie down on your back and keep your palms on the side. First, we are just going to do the alternate leg lift. So inhale, exhale, inhale, exhale. We'll just do it only for 30 seconds to 1 minute, whatever time you choose. But right now we are, everything is going to be in 30 minutes. So we're just doing it for 30 seconds, but later on for your own practice, you can increase the time to a minute, to 2 minutes, to 3 minutes, or maybe 15 minutes. So this is the posture here. This is the sequence. You breathe in and breathe out. Keeping your leg lift. Try not to touch the floor. We are almost done with this one. So another thing is you got to keep your leg, knees engaged. If your knees are not engaged, you do the best you can. Keep moving. Inhale, exhale. Keep your neck relaxed, hands on the side. Now slowly bring your legs down, shake it, and immediately raise your hands over your head, over fingers pointing towards the ceiling, palms facing each other. Now inhale, both legs up, and exhale, both legs down. Keep your knees straight and engaged. Inhale, both legs up. This is working on your navel chakra, the third chakra, the navel. So use your navel point energy. Use your navel energy. And if you cannot do both legs, just do one leg at a time. There's always lots of options. If you cannot keep your hands up, you can always bring your hands down and keep doing it. So whichever way you choose, it's your option, one leg or two legs together. But start with this. So inhale, exhale. The breath is even breath. Even breath means you're inhaling and exhaling equal time. This is also called breath of fire. Inhale and exhale evenly. So this is again, you can choose your time. We are doing it only for 30 seconds, but usually we do it 1 minute, 1 to 3 minutes. So both legs, you're using your navel point energy. Keep doing it. And you can focus on your breath and you can close your eyes and do it in a meditative way. Inhale, exhale. Last 10 seconds. I tell you, you are going to get this whole navel area. This is an abhikriya. You can reduce the fat around there with this. It helps to reduce the fat there around the navel area and your waist area and your leg area. Inhale, raise your both legs up. Suspend your breath. And exhale very slowly. Bring your hands down, bring your legs down. Keep your knees straight and relax. Now just relax for one full breath. Exhale. Inhale one more time. Exhale and bend your knees, hold your knees here. And just do the deep breathing. So inhale, exhale. Slow deep breath. So this is a set of 7 or 8 kriyas. Kriyas are called complete action. Complete action, you are using your body, your breath, and if you close your eyes and focus at the third eye, you can make it meditative. So this is, you can do it with your closed eyes too. Now, the next set is also in the set of 3. Your first position is going to be like this, on your knees, you're holding the knees like this. And when you inhale, you open your legs 60-degree angle and you open your arms up. So this is focusing on the sides of your navel. And then exhale, you bend your knees again, hug your knees. Inhale, open 60-degree angle, exhale. So open diagonally, open your legs diagonally. Inhale and exhale. Inhale, exhale. This is also, we are just going to do 30 seconds. The whole focus is towards your navel. So you keep using your navel point energy. Keep the breath even. Inhale, open, exhale, close. Last 5 seconds. Now inhale, open. Hold your breath. Exhale, close. Now hold your left knee with your both hands. Interlace your finger there. And just move your right leg, open and close, and kick your buttocks with your right heel. Just open and close. It's also very good for your knees. So just open and close. We are going to do this only for 15 seconds. So breathe in, breathe out. Breathe in when you open your leg and breathe out. This is kind of an express kundalini kriya because we are going to squeeze everything in our practice. We are squeezing everything in 30 minutes. So let's just inhale and exhale. Do the best you can. Now inhale and fold your right knee and open the left, and same thing we will do. Inhale and exhale the left knee and kick your butt with your left heel. So you can hear your breath. So this is your practice. Do the best you can at your own pace. You don't have to do it fast. You just do it slowly or whatever your pace, your body allows it. Now inhale, hold your knees together again, and exhale. Now we are going to roll the body up. So just couple of roll up and down. We are going to do this and coming into a sitting position. Here we are going to stand up. Stand up, but while we are standing up, make sure when I say bend your hands like this, like you're making a 90-degree angle around the wrist, and arms will be straight like this, okay? So let's stand up, okay? Stand up. Maybe you won't be able to, you should see my hand, but my hands are always 90-degree angle around the wrist, okay? They're bent like that. So inhale, we lift and lengthen your spine like that, very slowly. And then when we exhale, we bend from your waist, from that crease, bend forward. And bending forward, you apply the root lock. Root lock is when you tighten up your glutes, navel, and sex organs. You tighten up that when you're exhaling. Then again, slowly inhale, keeping your abs engaged. And then exhale slowly, and we are just doing the same thing again. Repetition is the key here. To keep repeating the same series, same sequence, inhaling up. And while exhaling, you make a root lock. Tighten up your glutes, navel, and sex organs. Do this for a minute. Make sure your palms are facing up towards the ceiling. Using your navel point energy, keep the focus there. You can always close your eyes and make it meditative. Now let's come up, inhale. Now what we are going to do, we are going to do the same thing, same exercise, but a little bit of rapidly. Only for 30 seconds. Tighten up your glutes navel organs and inhale up and exhale. Inhale up and exhale. Just increase the pace a little bit. Keep your hands facing up towards the ceiling when you come up. And inhale, come up. Hold up there. Exhale, bring your hands down. Sit comfortably, maybe cross-legged. Take your time. So this set is focusing on the developing the strength of the navel point, as I told you. We're just doing a couple of more, not couple, at least 4 more kriyas. So now what we're going to do, being the right leg, keep the right leg straight and sit comfortably. Make sure your spine is aligned and straight. And left heel, if you can only, you can place your left heel on top of the right thigh. So this is the posture here. If you can't, you always have an option. You can keep it near the inner groin or this like this, whichever way it helps you. So keep that right heel on top of the right. Keep your left heel on top of the right thigh. Your right leg is straight. Now slowly, we're going to inhale arms up. And then when you exhale, slowly bend forward and see wherever you can grab, either your toe or you can grab your ankle, or you can, if you can grab the toe, hold the toe with your middle finger and index finger. And then place that and hold it like this and press your thumb towards your toenail. And here the left hand, you can hold it at the base of your feet, the right foot. So this is the final posture. But if you cannot hold the toe, just hold your ankle or wherever you are comfortable with. So here we are going to, in this position, we'll do the breath of fire. Breath of fire, the same, even inhale, even exhale. But keep that rhythm. Inhale and exhale evenly. So you can do it slow and then increase the pace of the breath. So you can increase, you can do rapid breath of fire. Try to relax, and this breath of fire actually helps you to relax all your muscles. Now, if you focus on your third eye and close your eye, you just relax all the muscles and focus on your breath. Now inhale, suspend your breath, and exhale, go deeper. And slowly come up. Just roll your body up and switch the side. We are going to extend the left leg out and right leg, right heel on top of the left thigh. Just the same thing on the other side. So switch the leg, grab your toe, or you cannot, if you cannot grab your toe, grab your ankle. Same thing with your left hand, with the middle and index finger, press your thumb towards your toenail and then pull it towards you. And then here, You're using the right hand and the sole of the left foot. Now here, same breath of fire for 30 seconds. So when you inhale, your navel comes out. When you exhale, your navel goes in. Keep up the pace, maybe do it a little bit rapidly. Now inhale, hold your breath, suspend your breath. Hold your breath and exhale. Slowly go deeper, go down. This exercise opens up the lungs, balances the polarity of the aura, and also it stimulates the pituitary gland. Along with the helping of the navel, it also helps with the pituitary gland. Exhale and slowly inhale, roll your body up. And then again, extend your both legs out, shake them. And we're going to do this kicking buttocks, just like we did earlier, just for 15 minutes. So raise your legs up, lie down on your back, raise your legs up. Focus on your navel point energy and just kick your butt like this. With your heels, kick your butt like heels. Your neck is relaxed, your hands are on the side, you're just kicking your butt. This really helps with your knees also. So keep doing it just for 10 more seconds, and I'll tell you, this will help you and aid you with the digestion. Now inhale, open. Exhale, bring your both legs maybe 18 inches above the floor. And now here we are doing the pistoning. We are pistoning. So all this time, your legs will be parallel. They are not like a bike, like Dr. Ganapati was doing it. It's not the bike, it's pistoning. So you are always pushing, push and pull with your legs. The legs are parallel to Mother Earth. So inhale, exhale. Focusing on your navel. Keep the breath of fire, even inhale, even exhale. That's why it's called complete kriya, because you're using the breath, you're using your physical body, and you're focusing at your breath and your third eye. If you close your eyes, make it meditative. Now inhale, both legs up. Exhale, bring them down, shake your leg. Inhale, exhale. Now switch the side. We're coming to the navel and we're going to make the front platform, which is called plank. So you come on your navel side, lie down on your navel, and then slowly you keep your elbows on the side and you slowly lift up your body up, making a plank a back platform. Inhale and exhale slowly, and then you increase the pace and you do the breath of fire. So you close your eyes, make no thoughts, have no thoughts. Come into the shunya state and just focus on your breath. Now inhale, exhale, slowly lower yourself Coming to your tummy, on your navel, relax, breathe in and breathe out. Your heart rate must be going up. Breathe in and breathe out. This will give you the strength on the lower back and it stimulates the brain also. The last kriya, which is the hardest one, is called stretch pose. Stretch pose is again you coming on your back, lying down on your back, and it is kind of a boat pose, but you're not raising the legs above higher. You're raising the legs only 6 inches above the floor. Your chin is up, your arms are parallel towards each other, and palms are facing down. Your fingertips are pointing towards your toes, and your gaze is at your toes. So what you're doing here, you're smiling at your toe fingers. Even inhale, even exhale, focusing at your navel energy. Now inhale, hold your breath. So try to keep your knees straight and engaged. Keep it up, keep it up. Exhale, slowly bring the legs down, arms down, relax. Take your time, breathe in and breathe out. Now come in, holding your knees and just rolling up your body in sitting position. And well, this is the heart center stretch for healing. So sit on the easy pose, which is the last one. So we are going to keep your spine straight, and then we're going to open the arms like a V shape. So the center is the heart, okay? V shape, and you're opening your arms up. You're inhaling. Then when you're exhaling, you're making your fist tighter and pulling your hands. So bring the strain in your arms. Pull your hands all the way to the chest. And as soon as you touch the chest, you exhale. Inhale again. We'll just do 2 or 3 times. So tighten up your hands like you're pulling a 1,000-pound weight. So pull, 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 pull. And as soon as it touches your chest, exhale. One last time. Inhale, open up your arms. Make a fist, tighten up, and then pull. Exhale. Make a V shape again. Breathe in and breathe out. Inhale again. And when you exhale, bring your hands right in front of your chest. Keeping your palms facing towards each other. Feel the energy between your palms. Inhale and exhale. You may close your eyes and just feel that electromagnetic energy between your palms. Breathe normal. Feel that energy between your palms. And slowly bring your palms together to the heart center. Inhale. And keep your spine straight and bend forward. If you can touch the Mother Earth with your forehead down, do so. Or just bow, a gentle bow. Inhale, slowly come up. Place your hands to the heart center. And just last, we are going to just play this song, and you can repeat after me, or you can hear the song and just we'll finish the practice, today's practice. Make a long time sun shine upon you, and all the surround you, and the pure light stay. Guide your way on. May the long-time sun shine upon you, and all love surround you, and the pure light stay you, guide your way on. May the long-time sun shine upon you, and all love surround you, and the pure light within you, guide your way on. Inhale. We're going to chant one long Sat Nam. Sat means truth. Nam means identity, name. Inhale again. Sat Nam. Sat Nam. Thank you. Namaste. And now you can do the Shavasana or final Shavasana.
Aruna, due to the lack of time, we already passed our time. Let's proceed, okay? Thank you. Thank you, Aruna. You can mute yourself. Okay. Now, you see what we have done. We practice what we preach. What is our preaching? Preaching is practice in an empty stomach. So we all did our empty stomach. Maybe have a very little light breakfast, but not a full stomach. Now you have 1 hour of our lunch break. And what I request to all the participants, so if you can put your questions in the chat, we'll be able to answer those questions. I will come or I will ask our participants to answer during the lunch break when you're having lunch. After the lunch break, with a full stomach, we are not going to practice. This whole retreat is based on our practice. I'm going to present a formal presentation on yoga therapy for COVID-19 and post-COVID-19, what is called long hauler syndrome. Then Dr. Shastri Topali, who is also a pain specialist, physician, well-trained in yoga therapy and Ayurveda, will present the Ayurvedic yoga therapy for COVID-19. We'll take a little break and then we'll finish with a practice of pranayama, meditation. Then we'll open to all of you in a gallery view for direct question and answer. You'll ask the question to us, they can answer. Okay, so take a little break. So we'll come back at 1 o'clock for my presentation. Okay, I think everybody started to coming slowly, and I think we'll go ahead and start. So it's almost, what is that, 12:58 now. As you say, we are always in time, try to start in time, finish on time. I'm looking at the questions you have or comments. I don't see much questions. I see very nice comments from Ravi Deepak. Thank you, Ravi. Judy, I don't know, Judy is here. Judy had a question, how to download the handouts and the presentations. We have been sharing all of our practices and all of our slides to all the participants. So everything has been sent to you, probably as an attachment. This is being sent by Catherine from, call it a constant contact, which have some restrictions when you send the attachment. So if you're interested, if you make a little comments or point, we'll be able to send it to you via like a regular email. So it's up to you, and please let us know if you want it in a email format. Now, after the lunch, let me see, I may be able to get up a little bit more, sit in a better position. Yeah, we like to sit. This is our yogic stool. It's called a kneeling stool. Let me share. We said another comments here. Why yoga is good for the singer, Mandira. Okay, beautifully. Okay, so let's do one thing. Let's answer a couple of questions. They said the first, Judy asked how, so you're going to get your handouts and your all the slide presentations. Edwina asked use of oregano and turmeric. Okay, Edwina is interested. Edwina, both oregano, which is in Sanskrit called ajwan, and turmeric, which is called haldi. In Ayurvedic property, they are called tridoshic. Yes, Edwina is here now. Hopefully she's listening. Both oregano and turmeric are called tridoshic. That means it has a balancing of the vata, pitta, and kapha. Oregano primarily balances your pitta, also balances kapha and vata, so as your turmeric. From Western term, these has a powerful antioxidants. These are very powerful anti-inflammatory and anti-cancer medication. Only difference is the Ayurvedic herbs and products have some direct pharmaceutical effect, but it primarily works through body's own healing power. It stimulates or excites our body's healing power, and like it will work through what's called our Agni, Jatar Agni. It will work through our prana, teja, ojas. And this is called Ayurvedic yoga therapy. And generally we do present on our this yoga therapy retreat. But this year, because of our COVID-19 situation, we are going to talk a little bit about Ayurvedic yoga therapy on Corona COVID-19. Dr. Shastri Topali will talk to you and he will explain a little bit more. Please send an email format to me. Thanks. Judy, definitely. You send an email to me. My email is Dilip Sarkar, my full name, first name, last name, no period, no hyphen, @gmail.com. Mandira and Shapan ask, what yoga good for the singer? Oh, definitely. Yoga is extremely good for the singer and the dancers. In fact, I just did a program in Dubai just before this pandemic. It was in a dance and a singer studio in Dubai. The whole voice comes from your larynx for vocal cord, which we exercise or we get relaxation with your Ujjayi pranayama. Whole singer needs to have a longer exhalation. That's what we practice in yoga. So lung is like a balloon. It has a 6-liter capacity, of which you have a 4.5-liter vital capacity, which you can exchange. We only exchange 0.5 liter, 500 cc. So the practice of yoga, your capacity to breathe in and out becomes longer and longer, and it's wonderful for a singer. We teach singers to yogic pranayama. For the dancers, this is a relaxation response, and this is a hand mudras, all mudras for the dancers. So for the dancers also it is very good. Ravi Deepak, was there yoga medicine during previous pandemic like cholera? Ayurvedic medicine, Ayurveda and yoga, the root is in Veda. So Ayurveda and yoga in existence in Indian subcontinent for last 5,000 to 6,000 years. The origin is called the Indus Valley Civilization, 2 cities named called Mohenjo-daro and Harappa, which are now in Pakistan. Before the British came to the Indo-Pak subcontinent, the medicine treatment in Indian subcontinent was your Ayurveda and yoga. So the pandemics we had before, and every pandemic, the yoga and Ayurveda is being used, and especially in India even today. Today, Ayurveda is extremely good, and I'm going to show it to you just now, how good is Ayurvedic and yogic practice in COVID-19 and what Indian government is doing it today. They're promoting. There is a Ministry of India called Ayush, AYUSH, which stands for Ayurveda, Yoga, Unani, Homeopathy, Siddha and Homeopathy, SH, Ayush, they have a protocol for yoga and Ayurveda practice for COVID-19. And I'm going to show it to you. The people who are practicing yoga do not have much COVID-19. Is there any restriction for umbilical hernia? People who has a hernia, umbilical hernia or any hernia, it is a pressure from inside which will open up the hernia more. So the practice we do for hernia is called Uddiyani Bandh. And I'm going to show it to you probably Uddiyani Bandh during pranayama practice. But also remember, every practice you do, both asana and pranayama, in stages and as if it's your effortless ease. That means you are able to talk, able to sing. So any underlying medical condition is not going to hurt you. You are not going to do that exactly what we can do. So you'll be doing and listening to your body signal. That's what yoga and Ayurveda call the art of self-healing. Okay, let me start sharing my slides so you will see what we are going to go through now in next 45 minutes of presentation. And you will be seeing that if you have any question, please put the question and we'll be glad to answer for you. If you don't ask any question, then we presume that you understood everything, you know everything, then we will request you to make a comment or to teach us something. Okay, the topic here, and as you can see, that this is our Ayurvedic setup. Now, this is the room. This is my gym. I don't know if you have seen it in the back. In the back, I have a statue of Patanjali. This is a statue of Patanjali, and you can see it a little bit better probably. And we are sitting in a stool. It is called your kneeling stool. If you don't know what kneeling stool is, let me show it to you. It's very important when you are in front of a computer throughout the whole day. This is your kneeling stool. In a kneeling stool, when you sit down, you have your knees are here, your spine is always straight. So when your spine is straight, that is the minimum requirement for your daily yoga practice. Remember one thing, we're not interested about the practice you do. You're doing a half an hour, 45 minutes, 1 hour. It is what you are doing throughout the whole day. See, here I am. My spine is straight. That is the minimum requirement. That is probably minimum protection. So I carry a lot of hats, multiple hats you can see. And I've been all over the world for my presentation. And we'll be talking about COVID-19. Now, as yoga is a therapy, as you have heard at the beginning of the morning practice, that yoga as a therapy is an adaptation. It's an adaptation, remember, adaptation of the philosophy of yoga. Philosophy of yoga is the Yoga Sutra of Patanjali, 196 sutras, of which 193 are to quiet down your mind. Practice of yoga, 8 limbs. Yoga teachers, all of you yoga teachers, you have to memorize by heart. It will be Yam, Niyam, Asan, Pranayam, Pratyahara, Dharan, Dhyan, Samadhi. I have presented all this, but it has to be completely H. It is a daily routine. It is a lifestyle. And we have seen by the regular practice of it is a primary prevention, or we call it a preventive medicine. What is a preventive medicine? Preventive medicine is that if you are predisposed, like people say, I get a lot of flu, I get a very susceptible to COVID-19, or my father has a diabetes, my parents have a hypertension, genetically predisposed. We have seen that genetically predisposed, when you do a practice yoga as a therapy, it causes genetic suppression. It causes genetic suppression. It will prevent onset of the disease. And as you have seen in COVID-19, it's a respiratory virus. Its port of entry is in your mouth and the nose. So the use of ushapa, drinking water in the morning, use of your tongue scraping, use of your jalneti, washing, and then we do oleation of the nostril. We put a little oil in the nostril, especially put the oil in the nostril before you go to bed. And I'll show it to you. What happens when the nasal opening are oleated, there is no dryness. The mucus inside the nostril doesn't get dry. And for all practical purposes, the virus or a bacteria, any particles are not able to stick to your nose. Secondary prevention. Secondary prevention means, how do I change this? Just 1 second. Okay. Yeah, it's a little better. How do I change it? Secondary prevention, like when you have the disease, like when you have the COVID-19, that you are having a therapy, we are monitoring your pulse oximeter, how much oxygen you have, monitoring your respiratory system, cardiovascular system. I will go over with you a system by system how COVID-19 affects us and what are the yoga therapy for COVID-19 and post-COVID-19. So during the disease itself, if you continue as yoga therapy, it will prevent a progression. So the whole phase of COVID-19, if you've seen, I'll talk to you a little bit more, it may not progress. It will stop its progression, or it can reverse the disease. And then it's called your tertiary prevention. Tertiary prevention is a complication of the disease. Like it prevents the complication. Like a complication for COVID-19. COVID-19 has a multiple complication. After the infection in the lung, it affects your other organ directly, cardiovascular system, central nervous system, and also what it does, it has a secondary septicemia. That means sepsis or infection goes into the blood. Then you get a multiple organ failure. In a multiple organ failure is primarily our terminal event. Then you start having first the kidney fails. This patient goes to dialysis. The first the lung fails, so you go to a respirator. The kidney fails, you go into your dialysis, and finally, when the liver starts failing, that is your terminal event. So first, let's start with what COVID-19. COVID-19 is a disease from a virus. It's a virus, and the name of the virus is called SARS-CoV-2. This is the name you can see. SARS stands for Severe Acute Respiratory Syndrome, and COVID stands for Coronavirus 2. Initial name, when it was given in Wuhan, China, when it was diagnosed, it was given a name called novel coronavirus. Novel means a new coronavirus. And all of you know about COVID-19. So let me tell you what COVID-19 stands for. COVID-19 was a name given by WHO. It was exact date was February 11, 2020. So COVID, CO, it comes from corona. VI comes from the virus, D comes from the disease. So it comes to COVID, coronavirus disease, diagnosis 2019. So it was dropped as a 19. So it was called a COVID-19. So now we understand where the name came from. A lot of people ask where the name came from. Just to show you a little bit, today, if you just sort of search it, online search, the first search we do most of the time, we as a medical personnel, we look at PubMed. PubMed is a national, the online library for the National Medical Science Library. It's by the NIH. And if you just put a search engine, yoga therapy and COVID-19, today you'll get a beautiful, nice 55 articles. There's a funding by NIH, National Institute of Health. If you put a funding, it's called the clinical trials, called clinicaltrials.gov, and you will get about 10 trials. And interesting is the first trial, which is almost completed now, is called the Beth Israel Deaconess Hospital, which is the hospital for your Harvard University, and where it shows, and they're doing the studies, the prevalence of COVID-19 on the people who are practicing yoga therapy. And it's shown it very promising. There are a bunch of articles. I don't want to go through all the journals, but just to want to show you, the journals are full of it now, starting in the last February and March. All of our medical journals, 70, 80, maybe 90% articles are on COVID-19. One thing happened to the COVID-19 is the COVID-19, every medical knowledge, every public health knowledge has failed in COVID-19. But COVID-19 taught us a whole book of medicine. We learned so much. This is the virus which affected all of our body. This is from a Journal of Complementary Integrative Medicine in a preventing aspect of Ayurveda and yoga towards newly emerging disease of COVID-19. Next one is called Journal of Ayurveda and Integrative Medicine. It's called the Ayush for COVID-19 management. Ayush is the ministry in India, which stands for AYUSH, Ayurveda, Yoga, Unani, Siddha, Homeopathy. These are called traditional system of healing, which is present in India. So, how yoga therapy comes in play for COVID-19? The first, as Abha was telling you this morning, the initial reaction what we had for COVID-19 was a panic, fear, and anxiety. Panic, fear, and anxiety in Ayurvedic yoga therapy, we call it a vata disorder. And it is the therapy is a yogic stress management. Yogic stress management comes with a relaxation response, parasympathetic activation. And remember one thing, the yoga therapy is not a cookie cutting approach. Yoga therapy is a concept. Yoga therapy is the idea which we share between us, between yoga teachers, yoga therapy teachers, Ayurvedic yoga therapy teachers, because all of us have our own individual practices. And what we do, then we use our individual practices according to the concept. So we'll be doing a vata balancing practices. We'll be doing relaxation response, which Abha has shown how beautiful it is. And I have shown you how to do the activation of parasympathetic tone. So it's a respiratory virus. As I said, entrance is through your nose. And the prevention first is a dinocharya, daily routine. When you get up in the morning, drink a glass of water, sitting in we call a squatting pose or malasana, get a first bowel movement. You brush your teeth, massage your gum, take a little oil in the finger, massage your gum, your tongue scraping, and you do a netipat. So it is called the Ushapan. Then also you do, if you don't have a proper bowel movement, we do one called a Shankha Prakshalan. Shankha is your intestine, Prakshalan is the cleaning. It cleanses your intestine. Basically, what it does, there are 5 asanas. There's a whole gamut of your Shankha Prakshalan. We keep on drinking 2 glasses of waters, then you do the 5 asanas. But we also do 5 asanas. We call it a Laghu. Laghu means, short, Laghu Shankha Prakshalan. And I'll show it to you of all the 5 asanas. Tongue scraping is called a Jiva Prakshalan. Jiva is the tongue, Prakshalan is the cleaning. Jalneti, Sutraneti. I've shown you how to do a Jalneti, cleaning your nose. Sutraneti is just putting a catheter and thread. People ask me, where did you get it? It's a 12 French red rubber catheter, and you keep on practicing, and it's a wonderful practice once you start doing it. Nasya is putting a oil in the nostril, and we do it. I'm going to show it to you. How do you do it at night? Dhauti. Dhauti is a cleansing. Yoga says you are washing your face, washing your eyes, washing your hair. Why not washing your internal organs, like washing your stomach? Called dhauti. You drink a glasses and glasses of water, takes a 6-8 glasses, but it's a relaxation response. It is not a vomiting. Vomiting is a retching. In a retching, it causes tearing of your gastroesophageal junction, where the stomach and esophagus meets. It's a syndrome named called Mallory-Weiss syndrome. It causes bleeding. But in yogic dhauti is total relax. It's called a kunjal kriya. Kunjal kriya means water comes out like an elephant. Another important thing is your loss of smell and taste. Loss of smell and taste, obviously what happens, you all know, when the nose is stuffed, that means you cannot smell, you don't taste anything. And if you don't taste anything, you don't smell anything. These are part of our 5 senses. The 5 senses, I hear, I see, I smell, I taste, and I touch. Able to control your 5 senses, which is the 5th limb called pratyahara. Pratyahara starts with a controlling your 5 senses. We do call a pranayama called a Brahmri pranayama, bumblebee breathing. We shut down all of our 5 senses, put a finger in the, close your eyes, close your ear, close your mouth, breathe out through your nose, take a deep breath through your nose, and breathe out with the sound of a bumblebee. We'll practice it during pranayama practice. And what happens, our brain has a frequency, bumblebee has a frequency, 2 frequency interacts, cancels. It is called basically a harmonic resonance and keeps the brain completely quiet. And it is extremely effective for the loss of smell and taste. And I have a beautiful, I had a nice cartoon I wanted to share with you. No, it's a little dirty cartoon. Anyway, the cartoon is, there's a person in line and he had to let his air go a little bit. He had to release from his anal canal. Then he said, if you hear it, you're not maintaining the social distancing. If you can smell it, you're not wearing a mask. But if you still can smell it with wearing a mask, you don't have a COVID-19. It's a wonderful cartoon. I'll share with you sometime. So I get up in the morning, doesn't matter, first thing, I'm on my pajamas, I'm in my undershirt, I sit down, I keep a glass of water next to my bed, sit down, hold the cup up and drink a little gulp of water. It's going to, it may not start today, may not start tomorrow, slowly. And this is a therapy for every medical condition is known in the world. Doesn't matter what you have. You have a cancer, you have a metabolic syndrome. Remember, yoga therapy is not a reductionist. It is holistic. It is going to take care of a whole body. This is a Shankha Prakshalan. There are 5 asanas. The first asana is called a Untitled Chapter. Actually, Dr. Shaguna Chakraborty showed you all of them. Next one is called your Tirjak Tadasana, oblique mountain pose. Third one is called your Kati Chakra Asana, west rotating pose. Fourth one is called a Tirjak Bhujanga Asana. This is the fourth one. It's called an oblique cobra pose. And fifth one is called your Udar Karshan Asana. Udar means the stomach, Karshan is the massage. You sit down in a squatting pose, drop your right knee in front of your left foot, push it, and come to my class, you will see it. I do it all the time. These 5 asanas you do, these are called Loghu Shankha Praksalan. Tongue scraping is a must in a yogic practice. Remember, we are presenting yoga from the scripture, the way the scripture has given to us. We are not diluting it to like your Western yoga practitioners, just using asanas, cut and paste and do this for diabetes, this for hypertension. No, this is holistic. You need to practice Dinacharya. Neti part is a beautiful, beautiful item now. Now, just tell you one thing. This is available now even in Walmart. So when you see something in the Walmart, you know, it has penetrated in our Western community. ENT physicians are using it after your nasal surgeries. So this is the thing, I was going to show it to you. See, I have all this stuff in my bathroom and I really don't, this is my personal practice. Here I have a, this is the oil. Instead of oil, what we use is called a ghee. It's called a ghee, it's called a Indian clarified butter. The ghee. This is my salt. This is the salt. It's called your non-iodized salt. This is my red rubber catheter for Sutro Neti. These are my oil. Here is I'm doing a Jal Neti, and here I'm doing a Sutro Neti. No, COVID-19 virus will be scared of me. COVID-19 virus will not come close to me, as I said. There's a beautiful couple of articles, Channel Global Health. It's a hypertonic saline nasal irrigation in the, let me see, should be considered as a treatment option for COVID-19. And it's a prospective study, and it's a very wonderful study showing that the saline solution and the relationship between your COVID-19. But for us, it is not that the short-time therapy, we are doing it every single day. We are doing it every single day as a part of our lifestyle, and we're getting a tremendous benefit. The COVID-19 is not coming to us. Another scientific report, a pilot level randomized control. Basically, it is the Jalneti, nasal irrigation, and a common cold. What is done in a common cold? This is a very long randomized study, and I like it. I will show it to you. This is a practice which looks a little gross to all of us, but it's a personal practice, and we really don't show it to anybody. And I said, you take only selfie on that. Again, what I'm showing it to you, that I have this oil here, which is called a ghee, called a clarified butter, and this is before going to bed. Before we go to bed, especially before I go to bed, I know a lot of my yogic friends, we use our little finger. And as I said, we don't want to share with other people, but with a little finger, put a little oil. And a lot of people ask, if you're very particular about Ayurvedic yoga therapy, you will use a sesame oil for vata, you'll use a coconut oil for pitta, and you'll use a mustard oil for kapha. You dip it in, take the little finger, push inside the nostril, one nostril, go all the way high up, and massage the whole nasal cavity and put an oil all around. Do on both sides, then you go to sleep. Remember, our sleep, it gets interrupted, which is called a sleep apnea, which is a mouth breathing. Snoring, sleep apnea, these are all because of mouth breathing. You wake up in the morning, your mouth is dry, that means you are not breathing through your nose. So what is say in yoga tradition, you sleep through your nose. And one of the Indian tradition, I have at least one person who will understand. Shapon, Mundira, Shogono, they will understand. Nake tel diye ghumai. That means you put an oil in the nostril, then you go to sleep. Then you sleep better when your nasal passages are properly oleated. This is called a dhauti, called kunjal kriya, stomach washing. You keep drinking your water. We generally initially do the little saline water, 2 glass, 4 glass, 6 glasses. When you feel the stomach is full, you stand up, put your hand inside and touch your soft palate, and your whole water comes out as we call it a kunjal kriya. Like a kunjal means elephant. It's one of the kriyas called stomach washing. Once you do it, this is such a profound relaxation response, because when you're tight, you have a sphincter called a gastroesophageal sphincter. You have an esophagus comes down in the stomach, sphincter will be tight, no water will come out. The moment you have relaxation come out. A friend of mine, Shekhar, we teach our yoga teachers training courses, and we show them the live demonstration. This is the Ayurvedic clock called Dinacharya. It's a 4-hour segment in the morning. 6 to 10 is called a kapha time, which is we call it a manda agni. Our digestive power is very slow. 10 to 2 is called a pitta time, very strong digestive fire. 2 to 6 in the afternoon is your vata time, which is the digestive fire is very mobile, very, we call it not properly in order. So that what happens in yogic tradition, the main food is a lunch. 10 to 2 is a pitta time, that's our lunch. Evening, 6 to 10 is a kapha time, very poor digestion. So the dinner is very small, very little size. The dinner is about 2 to 3 hours before going to bed. Same cycle repeats, 10 p.m. to 2 a.m., the pitta time. At the time we are sleeping, and our strong digestive power cleansing our body is like your self-cleaning oven. And in the morning, 2 a.m. to 6 a.m. is the vata time. So of this, in the morning, 4 to 6, which is our most spiritual time, we call it a Brahma Muhurta. Muhurta is the time, Brahma is the name of the divine. So it's the time for the divine, and we do wake up and starts our daily routine. Here is one article, couple of articles in a Journal of Alternative and Complementary Medicine. Is a public health approach of Ayurveda yoga for COVID-19 prophylaxis. So remember, we're talking about prophylaxis here. And here is a global Ayurveda impact of yogic breathing technique on the well-being of healthcare providers of COVID-19, basically showing the effect of pranayama for especially the healthcare worker who are working in COVID-19, because that's what they've been working. International Journal of Yoga, there is a beautiful article, Yoga and the COVID-19, written by a very famous yoga teacher in India, name is Dr. Nagendra. He is the founder of one of the best yoga university in the world called Vyasa, that's in Bangalore. And so there are other articles, impact of yogic breathing technique on the well-being of healthcare professionals during the COVID-19 pandemic. So I didn't want to go through all the articles because these articles are still in their infancy, but just to show you there is going. The virus is coming to your nose through your respiratory system, and then through a phenomena, it attaches, the coronavirus attaches, it's called an ACE2 receptor. ACE called angiotensin converting enzyme. ACE2 receptors you connect and causes a profound inflammatory response. So one of our thinking is that a lot of people, we have a cardiovascular disease, takes a medication called the ACE inhibitor, which is inhibiting that enzyme, whether it has anything to do with the COVID-19, because COVID-19 is killing a lot more people with a comorbid condition, primarily also the cardiovascular disorder. This cytokine storm, and this what it does in the cytokine storm, it releases some inflammatory markers which started damaging our lung, filling up fluid, and essentially it causes the respiratory failure and called ARDS, Adult Respiratory Distress Syndrome. This is also a phenomenon called bradykinin storm. In a bradykinin storm, blood vessels will leak the fluid, tissue organ, and also it causes arterial and venous thrombosis. Like it blocks, called the blood clot. You might have heard that recent talk about the AstraZeneca vaccine is causing some blood clot. And these are the small blood vessel which gets blocked and may affect the lung to cause a long hauler syndrome or a post-COVID pulmonary fibrosis. So we know all of our research, all of our experience, publication, that yoga therapy is both anti-inflammatory and also anti-thrombotic. Primarily, the water metabolism, which we do during our daily dinacharya, daily routine, and also our relaxation response. It's a beautiful article by Herbert Benson. Herbert Benson wrote the first article in this country called Relaxation Response. He has an article showing the effect of relaxation response on inflammatory markers. He has shown the genetic expression, how the gene get expressed and gene gets suppressed. A proper relaxation response causes the suppression of the genes, which expresses your inflammation. This is another article, beautiful article from the Journal of Clinical Oncology, the yoga's impact on inflammation, mood, and fatigue in a breast cancer survivor randomized controlled trial. So think about, if we take out the breast cancer, the COVID-19 or inflammation, mood, fatigue, and panic, fear, and anxiety. So when you connect those, you can see how effective yoga therapy is in prevention, treatment, and post-treatment of your COVID-19. If you just put in the PubMed, the yoga therapy in inflammation, you will see almost 110 articles. And this is the article on the right side. It's called a Beth Israel Deaconess Medical Center for doing the study, the prevalence of COVID-19 on a yoga therapy practitioners. So let me go ahead and next few minutes tell you about the course of the disease and how yoga therapy works before we get into Dr. Shastri Topali, who will be talking about Ayurvedic yoga therapy and COVID-19. Generally, the incubation period is between 2 to 14 days. And the first 7 days, the COVID-19, the symptoms are almost like your flu. You have a little bit of a fever, dryness, cough, may lose your smell and taste. Then you'll have a body ache. Then you may have a little bit of a GI symptoms, nausea, diarrhea. But by 7 days, it generally goes away. So you generally say about flu that if you take a medication, it takes 7 days. If you don't take a medication, it takes 1 week. So after 7 days, the progression starts. So by 10th day, the people who have a COVID-19, they recover. And people who progresses, they start progressing after 10 days and 2 weeks, and it progresses into respiratory distress, respiratory failure, followed by multiple organ failure, and that is the end of our life. So here at the beginning, what is that? Used yoga therapy, continuing our dinacharya, continuing our yoga and kriya practices. In the lung, the inflammation, as I said, COVID-19 or coronavirus, SARS-CoV-2 virus attaches through ACE2 receptors and leading to called ARDS, Adult Respiratory Distress Syndrome. You the practice after your asana, relaxation asanas, primarily long exhalation, slow, gentle breath holding. It is called the breath holding after inhalation. We call it a Abhantarin Kumbhak. Kumbhak is the breath holding. And I will show it to you when you do the practice. Lung damage could be also from thrombosis of the small blood vessels, you say, and that causes pulmonary fibrosis. And pulmonary fibrosis, the lung cannot exchange the oxygen anymore. And the post-COVID-19, called a long hauler syndrome, it creates a tremendous amount of shortness of the breath. In the heart, it has a direct action of the coronavirus. That's what I'm saying. This coronavirus teaching us so many things. It causes the direct myocarditis, inflammation of the heart muscle, leading to heart failure, conduction abnormalities, and the heart and lung is connected. So when the lung starts to fail, it also starts to have effect on your heart. And some blood clot, thrombosis of the coronary arteries can cause your heart attack and damage to the heart muscle, leading to the heart failure. In the blood vessels, that thrombosis, which is a very important phenomenon in COVID-19 now, it causes a thrombosis or blood clot in both arterial side and venous side. In arterial side, it affects your lung, heart, brain, liver, kidneys, legs, and all the organs can have a damage. When it's in the brain, it causes stroke. The kidneys, it causes a kidney failure. And in the venous side, it's called a DVT, called deep venous thrombosis, and PE, called pulmonary embolism. So if you see the study for the AstraZeneca vaccine, there was I think it was 17 million, the vaccines were given, of which 37 or 40 people have the DVT and pulmonary embolism. But if you look at a normal patient population, that population will have the same thing. Finally, it ends up with a septic shock and multiple organ failure. In the brain, the arterial thrombosis causes stroke and the seizure. So coming back, what happens in cardiovascular system, we know a yoga therapy, a relaxation response, activation of parasympathetic tone, and a good pranayama causes increase in the preload. That means the venous return to the heart is better, and reduction in the afterload. It reduces called your peripheral resistance. So a cardiac function, like an ejection fraction, gets better and better with yoga therapy practice. For the nervous system, it is obviously yoga therapy is outstanding relief. Arterial thrombosis can cause a stroke. With a seizure disorder, one is new phenomena. It's called a Guillain-Barré syndrome. Guillain-Barré syndrome is, it's like it's the inflammation of the nerves, which causes temporary paralysis, which completely clears up. Risk of developing Parkinson's disease, Alzheimer's disease, PTSD, depression, anxiety, and all of you know, I do a whole teaching called yoga therapy for Parkinson's disease, yoga therapy for Alzheimer's disease, PTSD, depression, anxiety. So wonderful yoga therapy outcome for these conditions. So it's a very, very important phenomena to do it. Now let's talk about a few minutes about, we call it a post-COVID syndrome, or called a long hauler syndrome. We have seen this syndrome, it lasts about almost 10 to 30% of the cases, persist for months. Months means 6 months, 9 months, almost a year. People didn't get better, especially people with pulmonary fibrosis. There's an article in JAMA, Journal of American Medical Association, in February, showing 1/3 of the people, even with the mild symptoms, who were not even in the hospital, had a persistent symptoms for over 9 months and almost a year. This virus generally damages your lung, heart, and brain, and it affects more on the people with comorbid condition. That means people who have a diabetes, who has a heart disease, or people who have a obesity, morbid obesity, people who are overweight. Those people have a more your COVID-19. And as you can see, we had 500,000 deaths of the COVID-19, and many of them are with a multiple comorbid condition. Loss of taste and smell may last for a long, long time. We ask them to continue yoga practice, pranayama practice, and Brahmari pranayama practice. Lungs has a persistent shortness of breath because of pulmonary fibrosis. Now there is not enough exchange of oxygen. A persistent cough, and it's a devastating cough. We use a Ujjayi pranayam and we use a steam inhalation. We said, go ahead and take a steam inhalation. We just put a little bit of a pan with water, the steam comes out, we cover our head, put our head down, and we breathe through our nose in and out. Always breathe through your nose, and you may breathe out through your mouth. Do not breathe through your mouth. If you breathe through your mouth, you don't know where this goes. It also causes congestive heart failure, COVID myocarditis, autonomic dysfunction, and in cardiovascular, it causes chest pain, tachycardia, fluctuating blood pressure. I have a couple of people I know, their blood pressure is fluctuating. They're having a conduction problem 6 months following COVID-19. Causes deep venous thrombosis, pulmonary embolism, the skin rash, hair loss. We have learned, we have gone through a tremendous amount of learning process with COVID-19. SARS-CoV-2 virus taught us a lot more medicine than what we have learned in the last 50 years. Central nervous system, fatigue, extreme weakness, memory loss, lack of concentration. One is called a brain fog. This brain fog is lasting for months and months and months. Insomnia, dysautonomia, and you know yoga therapy is excellent for insomnia, sleep apnea. I teach a class in a medical school, yoga therapy for insomnia and sleep apnea. Chronic fatigue syndrome. I have 2 people I know at this today, they're having a chronic fatigue syndrome. And I told them to do the pranayama practice, and they're doing very well. And very hard for the physical and mental activity. GI tract, abdominal pain, diarrhea for weeks or months from autonomic dysfunction. So yoga therapy is activation of parasympathetic tone. It takes care of your GI tract dysfunction. Musculoskeletal system, persistent fatigue for weeks or months, and it's tremendously debilitating. I know a couple of people who cannot even get up from the bed in the morning, and sort of joint pain and severe pain. Let me finish with a couple of slides. We said, origin of yoga therapy. How do you learn where yoga therapy came from? A person took a picture of the children. We saw everything in the children. Remember, children are their mind and body all integrated. They love what they do. And this must have some effect in the body and mind to do that. Naturally, they will do Tadasana. Naturally, we will do the Vrikashana. They'll sit down in a Sukhasana. They'll sit down in a Vajrasana. Pick it up into Bhujangasana. This is a Salavasana, locust pose. Downward facing dog, Adho Mukha Svanasana. Cat pose, Marjarasana. We've been showing it to you, but see how beautifully kids are doing. Jathar Parivartanasana. It's another one, Jathar Parivartanasana. Upavista Konasana. We try so much to doing it. This is called a Balasana. Say Prasharita Uttanasana, Balasana. We do the head below your heart. We practice, but the kid does it naturally. Balasana, child's pose. That's the way child does it all the time. Supta Baddha Konasana, that's the way baby sleeps. If you have insomnia, we ask you to sleep like this. And this is what therapy. I sleep like this all the time. No kasana, both pose. Finish our last slide. This is a slide from Swami Satchitanand of Yogaville. He was invited in University of Virginia to give a talk to 500 doctors. He stood up, he wrote down in the board, illness and wellness, then he wrote down, then he marked, illness starts with I, Wellness starts with we. When you shift our mind and vocabulary in the body from I to we, the illness of COVID-19 became wellness for our body, mind, and spirit. Thank you. We have a few more minutes. We'll have a next presentation at 2 o'clock. So if you have any question, you can ask me. Let me unshare this so you can go back to your, maybe I will go to in a gallery view. And if you have any question, if you can put it down on the chat, or if you want to unmute yourself and ask, I'll be glad to answer. Or make a comments, please. Or tell us what you want to hear more. Or tell us what we can do for your next yoga therapy retreat. We've been doing for years and years. Okay. Judy, excellent presentation. Oh, you are our inspiration. You are our guide. We like your blessings. We like your guidance. Please continue that. She's one of our famous yoga teacher in our community. What else? Anything else? Still, the floor is open to all of you. Edwina might have something. She asked me about oregano and haldi, but this is yoga therapy. Just stick to physical practices now. You know, those things we'll keep later. Okay. So let's move forward. We will have this open session also at the end of our practices. So please prepare a question. If not, we'll pick one of you and we'll ask you to make a comment or make a present, or maybe prepare a comment, might do. And at the end, we are thinking about doing a certificate ceremony, if it is possible, technologically. We will have a spotlight. In a spotlight, I will be there and Abha will be there. I will be handing over a paper, like a certificate, to Abha, and Abha will give it to you, will mention your name, and you will be in a spotlight. So everybody will see all of you, and then you are going to make a comment. So Abha will do it. Okay, now I'm inviting our other teacher, is Dr. Shastri Tupali. Dr. Shastri Tupali is a pain physician, and he has been a rehab. Remember, he has been a rehab physician. He understands body's structural alignment. When he saw me sitting in this kneeling stool, you know, he really prayed. He said, yeah, that's the way you do. He have a tremendous experience in yoga and Ayurveda. He finished a complete Ayurvedic course, and now he's a Ayurvedic practitioner, Ayurvedic yoga therapist, and I will invite him to talk about Ayurvedic yoga therapy and COVID-19. Welcome, Shastri. You can unmute yourself and we'll put in a speaker view for you, so everybody will see you. Beautiful. Go ahead. Next 30 minutes is yours.
Namaste, everyone. I hope, namaste, everybody. Can you all hear me? Can you hear me?
Yes, we hear you very nice. We hear you loud and clear. Please proceed.
Now, how do I get my slide? Okay, can
You open the slides on the desktop.
Okay.
Go to the bottom, share screen.
Very good. All right. Om Sri Gurubhyo Namaha. Om Sri Matre Namaha. Om Namah Shivaya. It's almost a year since we have faced this situation, the COVID crisis. In the very beginning, I was talking to Dr. Sarkar, and we were talking about how everybody was handling the situation. And we saw so many interviews. So many experts came and they gave their 50 cents. There are a lot of meetings, a lot of emotions. Some people can pacify with their knowledge better than the other. At the end, we all swing to the side where the majority is. And at the end, nothing gets solved. Earlier, Abaji was telling, it is the state of mind. The state of mind of the people, how they reacted or they responded to the situation. It's all depends on your emotional stamina and mental stamina of a person. How do you react to your situation or any event? Unfortunately, we have to hit a crisis in order to realize how our mental status is, our physical status is. I mean, if that is true even for our personal lives. We only take dietary precautions when we are sick. We only take care of ourselves when we are met with crisis. We only take care of our finances when our financial situation is so horrible. So this is the situation. Everybody described an elephant. And the media gave their 50 cents. I'm not saying, the immunization or vaccinations or none of these things help. They do. But are they solving the problem? One thing different that happened this time. You see, this pandemic is not something new. The world has seen so many pandemics ever since the earth has started, the life has started. The only difference is now we have more social media and we have more gossip. Are we getting the right information? Are we getting the right talk? Are we just listening to some kind of noise? How about some social media distancing at this point? Because in the beginning, we only had about 22 deaths on March 9th and 565 cases. Now it's almost 550,000 deaths and 29 million cases already. It's like this. Everybody is doing a lot of work.
Shastri, can I interrupt you?
Yes.
You're not sharing your slides. We're not seeing your slides. Can you go down below on the green and put a share screen?
Oh, I see. Okay. I apologize.
Yeah, put a share screen. Do you see that? The green button in the bottom?
Yes. Sorry about that.
Okay. You open your.
Sorry about that.
That's okay. Okay. Yes.
So,
go ahead.
Earlier I was talking. Did you hear me talking?
Yes. We heard. Just go from there. From there now onwards. Don't go back. You don't have to go back.
All right. So the situation is like this.
No, it's not. No. Yes, go ahead. Okay.
Right here. Okay.
Click. Thank
Everybody
you.
is doing their job. However, they forgot to turn off the faucet. The problem is still there. There has to be a reason for that. Is it wrong for everybody to do their part in correcting the situation, whether these scientists or experts or whatever? why the problem is still existing. Suppose we have taken care of this COVID-19. There is going to be a new strain. Today, we're not just talking about a virus. We're talking about how to take care of this situation and how to address this issue. If we don't, there are COVID billionaires. There are people taking advantages of our emotions, our state of mind. Ayurveda is not a health science. I just want everybody to be very clear. It is not yoga. It is not health science. It is life science. How do you take care of your situation? How do you conduct this life? How do you make this amazing life possible? So when you think about the coronavirus, this is not new. This is the Lysol bottle. You know, Lysol spray? This coronavirus has been there forever. All that we have seen is a new strain. You know, in Vedas have described these viruses, these evil thoughts and bad situations as demons. Okay? So when we do any kind of ritual, first thing we do is we ask those evil spirits to go away. So we say, a lot of people, our Hindu culture, they have this understanding of that. First thing they do is we sprinkle our water and purify ourselves. Say that, Uttishtantu bhuta pisacha. Apparently, these are all demons, but we can't see them. You can't see the bacteria, you can't see the viruses, you can't see the evil thoughts, and you can see the evil spirits, but they cause and affect our mind, affect our body, and make everybody vulnerable. But what makes a person vulnerable? That's most important part here, right? So, do we have emotional stamina or physical stamina to withstand these kind of situations? We all know by now, a lot of people know about Vata, Pitta, Kapha, our three doshas. I'm going to introduce you to three different areas. They are Ojas, Tejas, and Prana. What is Ojas? What is Ojas? Ojas is nothing but the natural resistance to fight any kind of infection or even situation. It's a kind of natural immunity. What we get out of getting vaccination is a passive immunity. But what we have within is natural immunity. It is basically the essence of all vitality and immunity. Immunity not just for the virus, but also the situations, the life situations. You can actually compare it to like honey. It's like, you know, that's the most purified aspect of it, right? It's an essence. Like anybody know how to make a ghee, preparation of ghee? The end product is a super fine product. It's the ghee. And it has got a lot of immune characteristics. So what happens is, how do we have this ojas? The food we eat, we call it ahara rasa, the juice of the food we eat, go to different dhatus. We have rasa, which is blood, rasa, which is plasma, rakta, blood, mamsa, muscle, majja and asti, bone, and shukra, which is the sperm and ova. They all go, the nutrient food will go to the individual areas and become individual ojas, and they have the natural immunity at every single level. We can compare it to the gamma globulins or hemopoietic tissue, endocrine and nervous system, digestive system. They all depend on your lifestyle, amount of stress you have, depending upon the trauma, the quality of relationships. Wait a minute. I thought ojas is something that you eat a pill or eat a dietary supplement. I thought you can address it. No. It's all your lifestyle that brings your ojas. If you have a poor Agni, which I'm going to talk in shortly, you have poor ojas. So when you eat that food, then when you go to the individual dhatus, it will become apara ojas. Apara ojas is a raw ojas. Raw ojas, it's a quantity of about half anjali, which is about this much. If you measure this, it's like a half a cup of it. That is apara ojas. That apara ojas will become even superfine and only 8 drops, and it collects in the entire system, distributed to all the vital organs. For example, it's a sinoatrial node of the heart. If you have a bad and that is called para-ojas, and if you have that 8 drops, you have the deficiency of that para-ojas, that's when the death happens. The vital organs stop functioning. The way you convert this apara-ojas to para-ojas is through Agni, which is in the pineal gland, which is in our brain. It's right behind our Agnya chakra, right behind our Agnya chakra. Scientists compare to serotonin in our body. You see a lot of serotonin related issues, depression, anxiety, all those things. It is come from that. I want you to hold this thought. And that is, once it is converted from apara-ojas to para-ojas, it is called soma or called amrit. Amrit is but nothing but immortal nectar. Because of that, we all live. Nectar, it's a part of survival, the most important aspect of the survival, right? The pineal gland is the seat of Agni that converts the apara-ojas to para-ojas, and that is called a soma. Hold this right now, and I will come to that later. So what makes it a weak ojas? If you engage yourself in severe overindulgence in sexual activity, trauma, intense grief. Some people are always in grief and stressful, always angry, always anxious. Intense exercises. Some people run marathons like crazy. You know, some people drop dead at the end of the marathons. That's because of the lack of balance inside them. Viral infections. Now, the coronavirus is the example. Dr. Sarkar already talked about it affects all 3 dhatus, all 3 doshas equally. It is tridoshic. Viral infections, bad ojas. Balanced mind, kama, krodha, mada, lobha, matsara. I will come to that in detail shortly. Next thing I wanted to introduce is tejas. Tejas is the fire. It's called Agni, and it is present in all dhatus, like all. You have in your plasma, it is in your blood, it is in your bones, it is in your fat, it is in your nervous tissue, it's in all parts of the body. It is the main energy that transforms the ojas. This is the main energy that transforms our food, our emotions, and everything, including our experiences. If we have a good tejas, this ojas is going to be transformed into our prana, our life energy. Example of this tejas is your Jataragni. Dr. Sarkar always talk about Jataragni. You have a good Agni, you have a good health. Also, it is present in liver. It's in the form of Bhuta Agni. Scientists call it enzymes, hormones, amino acids. So what it does is pachana. Pachana is nothing but cooking and processing everything and make it readily available. So you can, it is available to be used. So there are some qualities of this tejas. Rupa. Rupa is the complexion. Any person who have a beautiful complexion, It's not the question. It's not they're fair or dark. It's complexion that they have the glow. It's also called Bhaswara. You know what Abha means? Abha means the glow. The Aruna is Rupa. We have two people, speakers just now in our program. That is Tejas, right? Udvagamita. Udvagamita is some people are never, they're always blah, always there. But some people are always full of fire, ready to go, right? That's Udvagamita. Paratva and aparatva. What is important, what is not important? Ability to discriminate. Sankhya. Multiplication. One cell becomes 2, 2 cell becomes 4, 4 cell becomes 16. And your sexual, your egg and the sperm, how they become a zygote and how they develop is part of the Tejas. That's what is responsible for all that. Another thing is Gati. It has got a direction. People with good Tejas have a good direction in life. So low Tejas, raw Ojas, people don't have enough fire. You can even compare it to people don't exercise. They'll accumulate a lot of urges, unprocessed urges, obesity. Some people want too much urges, too much stages. They'll be always on the fire. They'll dry up. So the quality of the tejas is quality of the ojas. Light has got tejas as its a potential energy. Fire or Agni got tejas as a kinetic energy. It's a moving form. So light, the potential energy which is there and giving illumination, it is a sattvic form of tejas. The fire is rajasic form of your tejas. Matter, which is a compact form, it's a consolidated energy. It is a tamasic form of tejas. You see outside in the cosmos, light, stars, planet, darkness. Actually, there are not that many. Only thing that is there, only light. We're only seeing the different frequencies of light. That's the creation. Consolidated form, just pure light. And when it is that is aggregating together, they'll become stars. Some are not stars, they're just planets. That's a tamasic form. That is a secret of creation. So there are not that many. That's only one. That's light. It's said Advaita. That's the fundamentals of Advaita. It's not no duality. Advaita. It's only one. That's light. That light, we call it Paramatma. Tejas and karma. Got Vedanta. I'm going into a little bit of Vedanta, but it's very important. We are all on this living earth for a purpose. There is a reason why we're here, right? Let's start from the birth to the death. We accumulate. Not only we eat food, we accumulate our body, and then we'll accumulate our emotions and our experiences. The life sufferings we undergo, right? So we accumulate our body. We don't take care of ourselves. Disease. What happens? You have to take medicine. You have to do suffering. Same way, some people take care of the body and they don't. Some people don't. Some people become rich. Some people don't. Some people get more mature. Some people get stuck. Some people's life seems to be so easy. Some do suffer a lot. All this suffering, all this is because of tejas and karma. You're karmic. This is the karma. There is a relation between the karma and tejas. in order to know the whole thing, you need to be a strong person to understand, to reflect on yourself and process these things and how to handle lifestyle situations appropriately. That's why life is not easy for a lot of people because they're not strong. Vedanta is not for weak people. Vedanta is for very strong people. The third concept we're going to talk about is prana, which is a vital energy, which is also called bala. Now, let us focus on a few things here, okay? Because everybody does a lot of pranayama and all that. Let us focus on few concepts. Thought is the movement of prana. Everybody has been talking entire day. The breath is the vehicle of that thought. You have to understand this. If we don't understand this, we will not become conscious. We don't understand the process. Unless we know the right thing, you cannot practice the right thing. We practice the wrong thing. There's no matter how much you practice, if you practice the wrong thing, it's not going to become right. And we see day in and day out. So what does prana do? Prana, when you take a deep breath, it will become several parts, several forms. Prana, which take care of, goes your vital, it has got vital functions. Go to the brain, right? Apana, it goes downwards first, it take care of the excretion. Vyana, take care of circulation. Udana, take care of your respiration. And samana, all digestive things. When we sleep at night time, within a week, our nails are growing bigger. Our hair is growing uniformly. Why is it taking all equally without it's happening already. It is a samana vayu inside you. It has got protective functions. It is also, everybody talk about prana, pana, vyana, udana, samana. Nobody talk about naga, kurma, kurukara, deva, dhananjaya, devadatta. Naga is burping. After we eat, God is telling us inside. The prana is telling us, oh, enough eating. Don't eat too much. It's not good for you. But unfortunately, that is screwed up nowadays because everybody stand and eat, sit on the dining table and eat all kinds of eating. So in the olden days, people used to sit, squat Indian style and eat. So what happens is when you're bending and eating, there is only so much quantity you can eat. Remember in the old classes, 1/3 food, 1/3 water, 1/3 air. God, natural system, it's a naturally formed that way. God has created that way. But we stand, we'll make our size bigger. That's why our obesity, our stomachs grows like crazy. Vivekananda, when he came to this country long time ago, he said, if you had to use the dining table, go and sit on the top of the dining table and eat. Don't sit on the chair. I hope it makes sense. The second thing, aura. I was talking about Abha, the tejas. It is this Kurmavayu gives you tejas. Krukara, hunger, time to eat. You work too hard, time to eat. Now, we eat all day long. We're not feeling hungry. We screwed up that Krukara Vayu. So it's no longer functioning. There is a time to eat. It's no longer anybody is hungry. Everybody is eating. I will come to Dhananjaya last. You're tired. It's called Devadatta. The Vayu, Devadatta Vayu, Pranavayu. Yawning. You work too hard. Time to sleep. Time to sleep. These are all the protective mechanisms God has created within us. The last one is Dhananjaya. Dhananjaya means this Dhananjaya Vayu aids in decomposition. For us, we have funeral systems, rituals, all those things. What about the birds? What about the animals? Small pets, small animals, they don't have cremations. Of not pet animals, I'm talking about other animals. What happens when they die? They swell, so they swell, because the Dhananjaya Vayu expands and then poof, goes away. What happens? Body becomes earth, blood becomes water, fire becomes natural fire, the prana becomes your ether. It's gone. Natural way God has created. Let us talk about few other things. What is awareness? Awareness in action in different frequency of time yields different quality. For example, your sattvic mind, your awareness is manifested as happiness, joy, contentment, and all that. Through rajasic mind, awareness is manifested as thoughts and feelings. This is important to learn these aspects when you do pranayama. Otherwise, pranayama makes no sense. You don't need to have counting 10 breaths in, 10 breaths out, hold 20 breaths. That's not pranayama. What are you achieving? You need to understand what your thought is, what is the purpose of it, what are the emotions you're having, where you're holding, how you're letting it go. That is a science. What is personality? Personality of an individual is a psychosomatic response of your three doshas inside for internal and external stimulus. There are environmental stimuli, the relational stimuli, the emotional stimuli. The subtle moments of emotions are the moments of prana. You're angry, you're jealousy, your hatred, your love. These are all the subtle moments of prana. Guess what? These emotions are held in the lungs. If you have a deep-seated sadness or grief, it's going to affect the upper lobes. If a deep-seated anger, hate, it will be in the middle. It will be deep-seated greed or attachment, it will be in the lower level. Let's all take a deep breath. Let's wash away all these bad elements. So instead of giving into these kind of emotions, what we need to know, we need to just learn how to observe feelings and let them go. What I mean is, after you do this pranayama practice, after some time, you start watching your emotions. Oh, I'm angry. Oh, I have some jealousy inside me. Oh, I have some greed inside me. I have hatred inside me. Once you notice that you have this kind of feeling inside your body, it is no longer hurting you. The problem is everybody, anger, jealousy, all these things are acting upon them. That's why it is affecting you. If you don't act upon them, it's not going to hurt you. If anybody read Rhonda Byrne's Secret, in that she says, think emotions as horses and you climb on them. Are you an angry horse? Are you a hatred horse? Are you a jealousy horse? Are you an irritation horse? If you did, why the hell did you get on them? Get off of them. Not entire secret book is great, but some of them are good, right? Anyway, when you watch and let go, that's how you cleanse your pranavaha strota. Listen, yogis, saints, some people who learn people, they all also have emotions. The difference between us and them, they don't act upon them. Honestly, some people say, some yogis, I'm going a little bit. You think Yogis don't have anger? You think they don't have jealousy? You think they're not horny? They know how to control it. Maturity is immunity. That's the resistance. Let's put some things together. Aging process is nothing but the deterioration and degeneration. It's all happens at cellular level. So the regeneration also has to happen at cellular level. So when we talk about Vata, Pitta, Kapha, Vata is the pranic life energy, Pitta aids in the digestion and nutrition, Kapha helps in longevity. But Ojas, Tejas, Prana creates aura. Aura is the defense mechanism. It's a substance, color, and movement of aura. This is what makes somebody a stronger aura, stronger defense mechanism. Some people, you cannot shake them emotionally. Some people, no matter what they eat, they cannot be shaken. Some people, the smallest irritation, you can crack them. Now, let's go back to the first slide. Suppose crisis hits, how you react, how you respond. It's all depends on your ojas, tejas, and prana. So if you have, what is the disease? If you have a weak ojas, that means there is a weak transmission of tejas. That means there is poor digestion. You will have more toxins, more ama accumulating in the body, and it seals up prana, and it weakens the body, and it opens all kinds of doors to all kinds of diseases. That is our body. Now let us look at the cosmos. Cosmos also has, we call lunar energy as cosmic plasma, cosmic ojas. Surya or solar energy is cosmic tejas. Anila, which is called, we call it Vishnu, is cosmic prana. With this cosmic ojas, tejas, and prana, the God is spinning the entire world, entire universe. Your stars, your universe, your stars, your planets, your multiverse, everything is spinning because of these three things going on everywhere on the top. The movement of Earth is also possible because of that. You know, we have ozone around the Earth. You know where the ozone, the word came from? Ojas. So if you think about it, the cosmic intelligence, cosmic energy, Earth, solar system, galaxies, universe, multiverse, it's like all going like in a mathematical order. If you see on the Earth, you have seasons, you have celestial events, again, going in a very methodical way in the same order. At a cellular level, the human intelligence, human energy, same way, it's an order, it's a chemistry. Every cell, everything functioning in an order. It's like a microcosm in this macrocosm. Cosmos means it's an order. Chaos means disorder. After all, whatever is here is order of there. Yat prinde, tat brahmanda. Shiva in Shiva Purana is described as Soma Suryagni Lochana. The guy is spinning the entire multiverse. This is his cosmic dance. We call Nataraja. Dr. Sarkar has Nataraja, Abaji has a Nataraja, Aruna has a Nataraja. This is the cosmic dance. Cosmic dance out there, cosmic dance inside here. Everything out there and the cosmos is right here. Let's go back. I was talking about the soma. When upper ojas from ahara rasa becomes para ojas by the pilu agni, I was talking about pineal gland that creates your immortal nectar, the prana, right? Remember that? That soma is transformed into that prana. It is a supreme intelligence. You all know Hitler, right? Hitler, one thing he did was he kidnapped a lot of learned people from Vedas from India, and he held them hostage. You know what they did? And he made them work for him, translate all the Vedas. To make the long story short, what he learned about this particular part. So what he did was he introduced fluoride into the toothpaste. So everybody wants to brush teeth. Everybody wants, they have to do that. So he wants to do like a very subtle way. What he did was everybody uses toothpaste and it has got fluoride inside. The fluoride inside will suppress the pilu tejas within the pineal gland. The people become more submissive. They don't have their mind of their own. People became very submissive. That's how he got control of the people. Is it not what is happening right now with all these billionaires taking care of the whole situation and playing with our emotions right now? Again, Abaji talked about it's all about emotions. So we have these ojas, tejas, and prana. When the tejas is weak, soma is not transformed into the prana. Then we have a raw intelligence, not matured intelligence, raw intelligence. When we have raw intelligence, you know what happens? You have incredible desires. Your anger will go out of control. Your desire will go out of control. Everything go out of control. And this root cause of all desires, all these problems is unprocessed soma. That desire need to be satisfied. Why it need to be satisfied? Because after all, we are life. We have life cycles. Brahmacharya, Grihastha, Vanaprastha, and Sannyasa. Kama, Krodha.
Few more minutes.
Everybody, once you're born as a human being, they all have these kind of problems, right? You all have karma. It's nothing wrong in having a karma as long as that karma is towards your wife, not about your neighbor's wife. If you can channel your anger into a right possible way, you can create wonders. There's nothing wrong in having moha, which is attachment towards your kids. That's a part of your duty. It is nothing wrong in saving money for your retirement. When it becomes unusual, when you miss the cycles, the rhythm of the life, some people never get married up until 50. Some people cannot have kids. They'll have effects. Current geopolitical situation also is because of this screwed up problem. The wars, biological warfares. Seems like we're all being possessed. Look at this cell phones. Look at the headphones. These techies, they do good like this right now, virtual meetings, but look at the bad effects it is having. The food we eat. At the end of the day, what we put here and what we put here does everything for you. Scientists, they want everything, the discovery. Yoga, Ayurveda, and Vedas talk about not just intuition, but they're also they're mixing intelligence with it. That is a piece scientists miss. That's why they don't have full answers for that. Most important thing is, if you tell your children, they don't understand. In order to tell the children, the parents themselves don't know all these things. The most important thing is the parents need to learn these things. They used to be part and parcel of our life at one point. Now, even parents have to learn. Look at, we're all learning right now. That's why people don't have the concept of feeling guilty. Here in this country, first thing I learned after I came to this United States is people are not guilty unless proven otherwise. So the people don't have a guilty consciousness. If you don't know what you're doing is wrong, how can you fix it? You're not even aware of it. Then you do the correction. Once you identify there is something wrong with you, then the correction process starts. Then you look inside. It is called antakarana shuddhi. The purification starts then. Then once you do practice, then you will have siddhi. Dr. Sarkar, I know I need 5 more minutes.
Okay.
Earlier we were talking about Surya Namaskar, right? Why is Surya Namaskar? Why is Surya Namaskar? Apparently, root cause of all our misdoings are our anger, frustration, all these things. So we pray God to protect ourselves from these sins we're doing every day. What are those sins? We'll be interested here, right? How are you going to do sins every day? All of us do some sins every day. Manasa, with our mind. Do you want to know all the sins we do with our mind every day? I'll leave it to your imagination. Vacha, with your mouth. How many times you're gossiping? How many times you're saying bad things? Hasta, how many times you're doing bad stuff with your hand? Pabhyam, with your feet. How many times you're going to the wrong places? Vadarena, with your stomach. What kind of junk are you eating? Finally, Sishna, with the genital organs. How many sins you're doing? We don't have ability to do this. We'll ask the God to wash our sins. Then we'll become worthy. And that the God will nurture us like mother. What do you ask when you're asking when you're doing Surya Namaskar? Not bending forward and headstand poses is not Surya Namaskar. You're asking for something you don't have. What you don't have is a buddhi. Imagine, we all have buddhi. How great this world is going to be. One more very important. I'm almost finishing. Almost very soon I'm finishing. Okay, please don't cut me off. We pray God twice. One in the morning, one in the evening. Morning and the evening time, it's called Sandhya. Apparently, sun has got 360 different type of rays. And apparently, you know what happens? In the morning, we don't feel like getting up. Evening time, we are feeling so lazy. You know why? Apparently, there are some demons called Mandehadi Rakshasas. They're always targeting the people who are weak. That's why they come and entangle you. Oh, don't get up. Don't do this. Don't do this. We are stuck. So the sun rays early in the morning, early in the evening time, they kill those Rakshasas. That's why we had to pray in those times. What happens when you do that? Oh, what are the characteristics of the sun? Sun apparently has Ojosi, it possesses Ojas. Sahosi, it will give you stamina or patience. Balamasi gives you prana. Bhrajosi, the radiation. Devanam Dhamanamasi, people with the well-possessed name, all these great people. All the greatness is because of that, because they have a good ojas, good stages, good prana. Then we'll ask them. We ask for these, give me that ojas, give me that bala, give me that tejas. Apparently, sun is a very good friend. He's one of the name for sun is Mitra. So our life will be like our friends, right? Normally, we always associate with right-minded people. Our life kind of style depends on the type of people you associate with. If you associate with yourself with sun, imagine the type of life you're going to lead. That is the reason why you do the Surya Namaskar. You know, this used to be incorporated in daily rituals. My grandmother never let me sleep after 6 o'clock in the morning. Everything has to be clean. We cannot use right hand for wrong purposes. We can only use right hand for eating, not for the left hand. Even though you're ambidextrous, you can only use right hand for the right things and left hand for cleaning. Cooking, we can, even now, my mother will not let my children touch any food in the kitchen when she is in the kitchen. Face covering when you're talking, praying to holy basil. Whoever has a holy basil in their house, there are no viral infections, no bacterial infections. Neem, turmeric. Because of all these things, WHO has made India, it has formed an initiative called Global Center for Traditional Medicine. India is leading that. And in the opening ceremony, Modi has talked. And if you want to come to the closest thing of a living yogi, right there. Very fortunate, very fortunate. 3 more minutes, Dr. Sarkar.
We don't have any more time. Hey, we already 2:45, you know.
Can I close it up?
Please finish it, you know.
Again, sadhana. We talked about pranayama earlier. We all know Ida, Pingala, Sushumna and all that. The last thing I want to talk about is awakening and kundalini. How do you grow up in life? Remember earlier I was talking about your emotions and stuff like that? We're talking about all your emotions at Muladhara Chakra, your survival, groundedness, procreation. We have to leave these stages at one level by observation, by doing pranayama. We have 3 granthis. Once you, Brahma Granthi, Vishnu Granthi, Shiva Granthi, once you pass those stages, then you'll attain.
Yeah, let's finish it now. Sasri, finish it. You know, we don't have much time, you know. So let's end it here.
This is all a science you need to learn in a systematic manner. Please, people need to have a real understanding of how these things are done. And then that's how you form your ojas, tejas, and prana. That's how you develop the immunity. Why I'm telling you is not like a class, but the concept is not there. People don't realize how to develop emotional and physical stamina. Thank you for this opportunity. I wish this is not a small talk. It's a very big talk.
I know. It's a wonderful talk.
I appreciate it. You all talked earlier. And hopefully this is a good talk for the discussion. Even I hope I have a chance to discuss few of these things. Thank you so much.
Unshare now. Stop sharing on the top. Go to the top of your slide. Put stop sharing. Beautiful. Okay, and can mute yourself. Thank you. And